Hello, YouTube. Let me get Facebook all set up. All righty. Hello, my friends. It's Jill Osborne from the Interstitial Cystitis Network. It is Sunday, January 24th, 2024. And it's time for another live IC support group meeting. Now, I did something this week that I was just curious how many actual meetings we've done. This is our 227th meeting. And when our meetings average at about, hello, Donna, 3 hours, sometimes 4, even 5 hours, that's over 1,000 hours of live support group meetings. I'm pretty proud of that. Anyway, my name is Jill Osborne. I'm the president and founder of the Interstitial Cystitis Network. I'm a IC support group leader. I've been doing this for 31 years. I'm also the founder of the Interstitial Cystitis Network, a medical publishing company dedicated to IC. We facilitate the largest IC support group in the world. I love my job. I love what I do. Hello, Gay. And whenever I come and do these meetings, I have one goal. I want to give you at least one new thing you can try that will get you to a better place. I also want to educate you and inform you and give you a new set of questions to send you back to your doctor if you're not getting better. Because I don't believe that we all have to suffer for the rest of our life. Our biggest barrier in the IC world is the perception that IC is in fact a bladder disease, when in fact it isn't. It's a neuromuscular disorder for the great majority of us. So if you're one of those patients where you were diagnosed 10, 15, 20 years ago, you were told you had an incurable bladder disease and you've done bladder treatments, but you're not better, there's an important reason why, because they probably missed the underlying cause, which in fact for a lot of us is tight pelvic floor muscles, a history of pelvic injury, trauma. There can be endometriosis, there can be fibroid tumors, there can be all sorts of stuff going on, which can affect the bladder. Now, I wasn't here last week because I was at urgent care. Because, hello, what a start for a new year. The colds and flus and COVID's going around right now are ridiculous. And I know exactly when I got exposed, which is I was at the bank about 2 weeks ago, a little bit less than 2 weeks ago. Somebody came in coughing their heads off. They weren't wearing a mask. They weren't covering their mouth. 2 days later, bam, terrible sore throat, couldn't talk, laryngitis, fever, swollen glands, you name it, it happened. But what was so weird about this is that it affected the back of my esophagus, my tonsils and the back of my esophagus. And so I really had trouble talking, and I still have a little bit of trouble talking. So we'll see how we do, but I definitely feel better. I was able to walk. I've been walking the last 2 days, so that is an improvement. What are we going to do in this meeting? We are going to talk about cold and flu strategies that are IC friendly. And I'm going to go over a presentation I did for the International Continence Society back when my throat was just starting. Let me tell you, there's nothing worse. I had 2 big meetings just after my sore throat started. I had a meeting with the American Urology Association on some new guidelines filled with a lot of very, very important doctors. And here's Jill barely able to talk. And then I had to lecture to the International Continence Society on patients with IC, and it was brutal, really, really brutal. So I appreciate your patience since I could not stream last weekend. Anne said, how are you feeling? I'm definitely better. Do you know how to tell what kind of flare you have? Absolutely, we certainly do. And can cotydynia cause a flare? Absolutely, that's going to be a pelvic floor flare. So Anne, do me a favor, remind me of that. I want to do my little presentation first, and then we'll come back into flares. Let me get a drink. I've got my hot water with a little bit of lemonade and a little bit of honey here. Now, you may be asking, how can an IC patient drink lemonade? Well, it turns out that it was never my bladder. I thought it was my bladder wall for decades. It wasn't. It was my pelvic floor. And the consequence of tight pelvic floor muscles is restricted blood supply. If your bladder is supposed to get 24 units of blood a day and it's only getting 10, are you going to have a healthy bladder wall? The answer is no. I did not respond to bladder treatments. I did not respond to antidepressants. I did not respond to DMSO. I did not respond to any of those bladder treatments for many, many years. And certainly I could not drink lemonade. But now I can. Why? Because we fixed my underlying problem, which was tight muscles, restricting blood supply, also known as ischemia. And I was shocked. I had COVID last spring. I was coughing so badly. The only thing I could think of was hot lemonade with honey. I bought some. I was shocked that I didn't flare. I've been drinking lemonade ever since. Haven't flared once. So that's what I wish for you. You are an anatomical mystery to be solved. If you're not responding to therapy, let's take a step back, revisit the diagnosis. Let's see if we can figure what the heck could be going on. And remember, too, I'm not a doctor. I can't give you medical advice. My job is to give you a new set of questions to take back to your doctor. All right. So let's just talk very briefly about IC cold and flu strategies, because this comes up every winter, and it certainly came up a lot with COVID. So how do we determine what is an IC-friendly cold and flu strat? Well, you tell us. So what we've done about once every 5 years is we survey hundreds of IC patients, and we say, okay, what's your go-to? What can you take that will not irritate your bladder, that will help you with this stuffy nose and this terrible sore throat? And your wisdom is always welcome. And your experience is important because we can use this to educate others. So right now, these are our go-tos. So in terms of decongestion, number one, a saline rinse, an ocean rinse, any sort of sterile saline rinse, or a neti pot. And if you're doing your own, you can do a 1/4 teaspoon of baking soda in a warm cup of water and rinse your nose out that way. I am a Vicks Vapor Rub girl. I love Vicks Vapor Rub. I don't know why. I do. I have a tub of it next to my bed. Almost every night I use a little bit of it. So I have been, especially if it's mosquito season, because I hate being bitten. Mosquitoes don't like Vicks Vapor Rub. Anyway, so let's just say last week I was bathing in Vicks Vapor Rub. It was pretty funny. But look at what I found at the store. Vicks Vapor Rub shower tablets. So imagine taking a nice warm, if not hot shower, and being able to put this at the bottom of your shower. The warm water activates it, fills up your shower in your bathroom with very, very good calming and soothing scents that will help resolve some of your congestion. I haven't tried it yet, but I thought I would share that with you guys. I think that's pretty darn cool. Now, I'm not a fan of things like bath salts, anything that you put in water if you're taking a bath. I'm certainly not a fan of, because for those of us who have central sensitization and very sensitive skin, that doesn't really work for us. But something like this, a shower bomb, might work for you. Also, a Vicks nasal inhaler. Love these things. Love, love, love these things. Nothing bladder irritating in this. You can make your own steamer with some hot water, salt, a little bit of thyme or chamomile. And you can use Naturade and herbal expectorant. That was highly recommended by other IC patients. Sambucol black elderberry original syrup, or black elderberry cold and flu relief tablets. Quite a few patients have used those. And there's one other shower bomb that's called Oh My Stuffy Nose Shower Bomb that you can put in a hot shower. All right, so those are our top decongestants. And while you're listening to this, if you have any other ideas that you want to share with us, please, let us know. What do you do? What do you do? Okay, for sore throats. Now, generally, I see patients prefer anything with honey. Honey is not bladder irritating. In contrast, some of those sore throat lozenges are going to have artificial sweeteners in them. They're going to have a lot of artificial colors in them that are going to be more irritating. And so, again, something like hot water with honey in it is fabulous. Okay, but again, getting back to sore throats, Floraseptic throat spray, absolute go-to. Ricola cherry honey throat lozenges. I've been able to do Ricola quite well over the years. I was shocked though, gosh, what was it, first year of COVID, because I have allergies, especially in the summertime, and I often have a really bad nasal drip at night. Not helped by the many, many books in my house, which are going to be going soon. Um, and so I would have moments when I had trouble falling asleep because I kept feeling like I had to swallow. And so I would suck on Ricola lozenges, and I was sucking on the sugar ones. And, I mean, I'm really, really good with my oral care. I haven't had cavity in quite some years, except for the fact that one year I was sucking on like Luden's cherry or Ricola just to calm my throat down. I had cavities from it. I had a couple cavities up at the top of my root line. My dentist was shocked. I was shocked. And they go, what are you? Because I don't eat candy. I mean, listen, maintaining teeth these days is difficult. I have put now $30,000 into my teeth in the last decade. How is that even possible? Because my darn dentist as a childhood hollowed out all of my molars and put silver in them, and they all cracked. And so I have like 9 root canals and crowns in there, including my front teeth. And now we just did 2 on the side. Not my fault. So I'm very, very invested in really good teeth care. And I'm very, very blessed that I had that money that I could use over a long period of time to try to keep my teeth well. But that said, be careful with sugar-based throat lozenges at night. If you need to, you can do an artificial sugar one. Just don't do a lot. So occasionally I will go for a Ricola sugar-free lemon. But again, I'm not bladder driven. I can tolerate lemon. You might not be able to tolerate lemon. What's an absolute favorite for sore throats? Just a hard honey candy. A hardened honey on a stick that you can suck on. Just brush your teeth really well afterwards. Got to keep that really well. Sambucol black elderberry orange syrup, original syrup rather. Luden's honey licorice throat drops. Of course, gargling with warm salt water is important, and having a cup of chamomile or peppermint tea with honey. Hello, I got peppermint in this, I got honey in this, I got a little bit of lemon in this, and warm water in this. Okay, what can we do for coughs that are IC friendly? Well, again, what our IC patients have shared over the years is that Ricola cherry honey lozenges are the top favorite for coughing. Hall's mentholyptus lozenges. Werther's hard caramel candy for dry cough. Mucinex for chest coughs. And Naturade herbal expectorant if you've got that deep, deep, productive cough. Now, here's an interesting thing, because I called a couple of people Friday as I was kind of updating our cough information. Hydration. It's so important that we stay hydrated. And yet, some people are going to be sensitive to Gatorade. Some people are going to be sensitive to Pedialyte. I mean, it's really, when you look at the ingredients, it's rather shocking what's in them, even though I am a diehard lime Gatorade drinker. Not recommended. And I got chewed out by my doctor a couple of months ago for drinking 1 Gatorade a week. It's like, you can do better than that, Jill. Lose the Gatorade. So what can we do that's bladder friendly for hydration? Well, you can do half pear or apple juice combined with with 50% water. Heat it, and then you can flavor it with a dash of cinnamon or lemon zest. Lemon zest is not acidic like lemon juice, so a little bit of lemon peel might work for you. You can do some hot organic chicken broth. Again, feel free to dilute it. You can do hot water with honey, chamomile and peppermint herbal tea, etc., etc. And of course, our favorite homemade chicken soups. I made a big pot of chicken noodle soup about 4 days ago, and I just finished it up last night. And what was so interesting is so many people right now who are getting these colds and flus are also getting really, really nauseated. There's a lot of vomiting happening, a lot in my friends. I have one very, very good friend who just suddenly started vomiting. She vomited for a week. And it was a different manifestation of this flu. I haven't thrown up since I was a kid, knock on wood. I don't want to jinx myself, but I was gagging a lot. And so I may have had kind of that same virus. I'm not sure. And of course, if your symptoms become more severe, if you're sort of very, very throat, and you can barely swallow, like me last Sunday, you may have developed a dangerous strep infection, and you want to make sure you get in, you get checked for that. I did get checked for that, and I was strep negative. Also, in these days, we want to make sure that you get checked for COVID, because we certainly want to protect those around us and not give them COVID, because long COVID is such a dire situation right now. Now, I would love to hear any ideas you have, any products that you have about what do you do as an IC patient when you're struggling with a cold and flu? How do you handle these symptoms? All right, let me get a drink. We're going to see how well my throat handled. I mean, I was able to talk for about 2 hours on Friday. So we'll see how I do today. All righty. Now, and of course, rest. That's like the biggest thing of all when your body is struggling. I know that there are a lot of people out there. You don't want that. You've got things you need to do. You're going to keep working out. You're going to keep going to work. And what you're not doing, what you're not understanding is you're affecting your immune system. Very, very important when you're sick to just stop and chill. Rest. Give your body time to heal. And so I deliberately did not go walk for 2 weeks. I could tell that I was really, really sick. And my best plan was to cocoon at home, which is exactly what I did. And then, of course, when the throat got unbearable, that's when I called the doctor and said, you need to check this. Actually, you know what it was? It was a doctor when I was doing my International Continence Society presentation, and they could see how hard it was for me to talk. She texted me and goes, you sound like you have strep. This has gone on a long time. You need to go to the doctor. And I'm like, I'm okay. For a couple of hours, she kept texting me, Jill, go to urgent care. You need to get checked. And I'm like, I'm okay. And then finally, it just like dawned on me about 4 hours later, God, Jill, you're really sick. You need to go to urgent care. And I called and I got in the next morning. I'm glad I went too. I think it was important for me to go. All right, so that's it on cold and flu. If you have any other tips and strategies, please let me know. Hello, Margie on YouTube. We are simulcasting live. If I'm looking over here, I'm looking at YouTube. If I'm looking straight ahead, I'm looking at Facebook. So hello, Margie. Hello, Barbara. Hello, Donna on YouTube. Nice to see you. And who do we have right now on Facebook? Hello, Gay. Nice to see you. Hello, Anne. Hey, Deborah. Hello, Paula. Hello, Kayleen. Long time no see, and I made a promise to you, no red or gold. If there's anybody out there who likes computer games, we have got a nice little Fortnite thing going on. And let me tell you, so if anybody out there plays Fortnite and you want to join a little IC circle, we would love to have you come in and we'd love to play with you. I have never laughed so hard as I laughed last night, and that was due to Kayleen. Oh my God, we had so much fun. So again, if anybody loves to play Fortnite like I do, or any other computer game, send me an email, icnetwork@mac.com, icnetwork@mac.com, and we'll make sure you invite you and make friends with you so that we can play. We generally play later, after dinner. Okay. Hello, Deborah. Hey, Pauline. Hey, Debbie. Hello, Edwina. She loves Vicks too. Killian says, I need something to knock the nosebleeds out. I actually had a nosebleed in the middle of the night, which kind of freaked me out. My mom used to get a lot of nosebleeds too. I think for the most part, it's just very, very, very dry skin. If it's happening all the time, generally you want to go to the doctor and they can cauterize that blood vessel. But if it's just now and then, especially if you're sneezing a lot, et cetera, getting some good hydration and getting a good humidifier might be helpful enough. Let's see here. Hold on one second. Lori said, felt a tiny bit of bladder pain 24 hours after my pelvic floor therapy. Is that normal? Yeah, definitely. They had electrical stimulation for therapy too. The other half I had to do. Cool. I think that's reasonable. Anne says, if you have COVID, the doctor will not see me. Yeah, doctors, listen, you got to understand, we lost a lot of healthcare providers in COVID. Remember, like 1 million Americans died during COVID. Quite a few of those were people in the medical care industry, whether they were doctors, whether they were nurses, even janitors. And so they are gun shy. As my primary care doctor said to me last fall when I was going in for blood pressure issues, she said, Jill, you have to understand, and on any given day, half of our entire medical team is out with COVID. That's why you can't get in. And so we have to not be angry about that. We clearly see, none of us 5 years ago could have imagined living through the pandemic that we lived through. And God bless those who did not survive. That's just absolutely heartbreaking. But what we did not understand is how that would affect every aspect of our lives, specifically access to healthcare, even dental care. I lost 2 teeth 18 months ago. I still don't have my crowns. It's ridiculous. But on the other hand, it's not their fault. And a lot of doctors now are going into jobs that are all virtual. They just want to save their life. They want to save their family's life. So whenever you work with a doctor face to face, you need to have an attitude of gratitude here. Don't be angry at them. They risk their lives to care for people. And they're still risking their lives to care for people. And we've got to do everything we can to encourage and nurture and appreciate those care providers who are willing to do that to help us. Let me see here. Diane said, I had COVID after Christmas. I'm still a little tired, but the worst was over in a week. I'm glad you're better, honey. Hello, Lori. Kayleen says, Fortnite, always the highlight of my night. Me too. It's nice to be able to just step away from all the challenges of life. Lori says, Vaseline of the nose with a little bit of Q-tips can help with that bleeding. Will I go with flares? Absolutely. Lori said, RSV is bad here more than COVID. Yes, RSV is going around everywhere. And Lori said, a nurse friend told me people who got the vaccine and have IC had worse symptoms from what was reported. Oh, that's utterly ridiculous. I have every COVID vaccine you could get because I was trying desperately to save the lives of my parents. I've had COVID once, and that was from the hospital when they died. And my symptoms were very, very mild, and I'm so grateful for that. But I'm also back to wearing masks because honestly, I don't want to get sick again this winter. So I'm wearing a mask when I'm going out now, the great majority of the time, because 2 weeks of the sore throat from hell was not fun, and I got things I need to do. Okay, now, Before we get into flares, well, actually, let's talk about flares. Okay, so understand that because there are distinct patient groups, so remember we got patients with Hunner's lesions, big open wounds on their bladder. We've got patients with bladder wall driven symptoms that are either caused by chemical injury, like patients who are going through chemotherapy, patients who drink a lot of diet soda or coffee or green tea. They're going to have an injury to the bladder wall, basically kind of like a chemical burn to the bladder wall. We got patients with estrogen atrophy. So in that case, their bladder can't defend themselves well from irritants. We've got pelvic floor patients, a great majority of patients, 85% of patients actually have tight pelvic floor muscles. We've got pudendal neuralgia, and we've got widespread pain. And I can feel my throat talking to me. I mean, it's just straining. So bear with me. There's going to be a lot of drinking today. Okay, so because of this diversity, we also have a tremendous diversity in the types of flares you can have. So concept number one is going to be a diet-induced flare. So let's just say you have a compromised bladder wall. You have a compromised bladder wall because you got Hunner's ulcers or estrogen atrophy or chemical injury to the bladder, or severe ischemia from tight pelvic floor muscles also leaves your bladder wall vulnerable. So let's just say you ate or drank something that you know you shouldn't have done, and an hour later, your bladder's screaming. You know, a lot of people get very, very confused because some flares happen within the first hour because it takes about 45 minutes to an hour for something that you drink to arrive in your bladder. So I can still remember one of the worst flares I had was at a movie theater watching a Harrison Ford movie, and I ordered a fountain 7-Up. So it wasn't a can of 7-Up, it was a fountain drink where they added the flavoring, and then they added the water. Holy hell, mother of God. I was in agony 30 minutes later. Absolute agony. And I was sitting there with my boyfriend at the time and some friends, and I'm just squirming. I get up, go to the bathroom. 15 minutes later, I get up and go to the bathroom again. I barely make it through the movie. They all go out to a bar or whatever, and I drive home sobbing in pain. I knew better. But I just wanted to be with my friends. So what are we going to do for a flare like that? Well, number one, it was acid. So the first thing you can do is you can dilute the acid. Drink water. And not a lot of water, just a big glass of water. You don't have to drink 5 big glasses of water. Just get some water in there to try to dilute some of the residual acid from what you've eaten. The second thing that you can do is you can alkalinize your urine. So what does that mean? We turn it from acidic to neutral. We can do that with a little tiny bit of baking soda in a glass of water, like a quarter teaspoon of baking soda in a glass of water. Not a tablespoon, not a heaping teaspoon, a quarter of a teaspoon. That's enough. Some people think more is better. That's absolutely not the case with sodium bicarbonate because, number one, it's sodium. It can raise your blood pressure. And number two, we don't want your urine to become alkaline. We want your urine to be neutral. So for those of you who haven't taken chemistry, there are two extremes when it comes to acidity. We've got things that are very, very acidic, like lemon juice or hydrochloric acid, as compared to things that are very alkaline, like bleach. So I can still remember in my first chemistry class, we had excellent safety. Our lab director said, I was a freshman in college, said, bleach will eat your eyeballs out just as quickly as sulfuric acid. It's like, okay, that's pretty blunt. Think about it this way. If, we know tragically, especially in the Middle East and in Asia, some men quote unquote rejected men have been known to throw sulfuric acid on the faces of the women and girls that rejected them, leaving severe disfigurement. Talk about cruel. So acid is bad. Acid to that extreme, we're talking a pH 2, pH 3, devastating to tissue. But high alkalinity is equally devastating to tissue. If you've ever spilled bleach on your hand, okay, what happens? It gets very slippery. It might not hurt right away, but why is it slippery? Because it's dissolving your skin. It's dissolving your skin. That's bad. So our goal is to be pH neutral and pH 7. Now, some people think, okay, I'm just going to drink a lot of alkaline water. And again, I believe that that's a mistake. If you ate something super bad and you've got a bladder wall flare, I'm cool with 1 bottle of alkaline water. That's it. This is not about having a lot of alkaline water every day, all day, because that's going to push your pH way in the wrong direction, and your urine is still going to be irritating. Okay, so number 1, drink water, dilute your urine. Number 2, alkalinize your urine. You could suck on a Tums. You could do some pre-leaf, which you can see on the shelf back there. Pre-leaf, which is our top supplement in the ICU world. It's a simple calcium blisterophosphate tablet. That will 2 tablets of pre-leaf will reduce 95% of the acid in a cup of coffee, for example. So normally pre-leaf is used when you're eating something that can be a little bit risky. You can also do a pre-leaf if you're starting to have a very severe flare. You just don't eat pre-leaf like candy, okay? Be purposeful with it. We don't need a lot of extra calcium in your body because that could lead potentially to kidney stone. So just use it as you need it. What else can you do? You can do a bladder wall anesthetic like azo. This is over-the-counter azo. That's the stuff that turns your urine red. And most of those incidental bladder wall flares from eating or drinking something that you shouldn't have should resolve in a couple of days. If it is not resolving, you can call your doctor and ask your doctor for a rescue installation. A rescue installation is basically lidocaine to numb your bladder wall and heparin to coat your bladder. And we can do that to try to break you out of this flare and to directly calm that bladder wall down. It's a rescue for a reason, because most patients who have a rescue walk out of the doctor's office pain-free for several hours, and that's a tremendous relief. Okay, so here, hold on a sec. Yamo, hold on that. Eddie, hold on that. But Eddie said, can a blood thinner alone cause a flare-up? Not that we know. Borea says, you've got the flu. It stinks. Girl, I feel your pain because I was there a week ago. Okay. Now, let me offer something else. You have to understand that the bladder is the slowest healing organ in the body. Nothing happens overnight. It takes 2 weeks for one cell to be repaired. 2 weeks. And while that new cell is trying to so why does it take 2 weeks? Because the bladder has the largest single cells in the human body. These are ginormous cells that line the inside of your bladder. We call them umbrella cells. And when one of these cells is damaged, there's a little tiny stem cell underneath it. And that stem cell's job is to grow and replace that umbrella cell. But it takes it 2 weeks to do that. Here's the thing that a lot of people don't understand is that stem cell, while it's growing, is exquisitely vulnerable to acid. So if, let's just say you have a diet-induced flare, you had a cup of coffee, it killed your bladder, it's now a week later, you're like, oh, I'm going to have a cup of coffee again. I'm not going to let IC rob me of my coffee. I'm going to do it anyway. That second cup of coffee within that 2 weeks destroys the entire generation of cells trying to repair your bladder. Every time you cheat with a strong acid, for those of you who have bladder wall damage, every single time you cheat, you set yourself back 2 weeks of healing. Now, where did I get that information? I got that from a National Institutes of Health lecture taught by Dr. Anthony Schaefer about 20 years ago. And he was very clear. These stem cells are fragile. So generally what we do is for newly diagnosed patients who are IC subtype 100 lesions, IC subtype 2 bladder wall driven, we want you to be on that diet for a good 3 to 6 months just to let the healing process happen. Because some of you do not understand that you're perpetuating the injury because you're not giving your bladder lots of time to heal. And so when we think about that IC diet for bladder wall driven symptoms, 3 months minimum, 6 months, just chill out. Give your bladder time to calm down. And as your symptoms improve, don't get cocky and go, "Oh, I feel better 3 weeks later. I'm going to do it again." Don't do that. We've got to give the bladder time to heal. Maybe again, 3 months, 6 months, you can slowly start to reintroduce some things. And let's see how your bladder does now that it's actually had time to heal. Okay, so that's one type of flare. Another type of flare is a pelvic floor flare. So these are the flares that happen when you're driving for a long period of time or after you've had sex, or if you've been sitting for a long period of time, or you've worked out really hard, or you've fallen. So the symptoms are similar: frequency, urgency, pressure, pain. But instead of having pain on bladder fill, you tend to have pain afterwards. And also, bladder wall pain is very sharp and shrill. It feels like razor blades. In contrast, pelvic floor pain is duller and achier. It's dull and achy. And so pain after urination, pain that's dull and achy, we're always going to look first to the muscles. So what are we going to do for a muscle flare? Number one, heat. Heat relaxes muscle. So sitting down, laying down on your bed in a recliner with a nice big heating pad, warm heating pad on your belly, just to help these muscles chill out, is a great way to go. Or taking a hot shower or a hot bath with maybe a little bit of baking soda in that. Let's just chill all these muscles out throughout all of our body. We just need things to calm down. If you have a skeletal muscle relaxant like Flexeril or baclofen or a vaginal Valium suppository, or as somebody recently demonstrated for me, it's a whole long story here, medical marijuana, CBD, can be quite good at just calming things down a little bit. That's a whole funny story. It was one of my dad's older friends who was over helping us after my dad passed away. And we were sitting at the table just, talking about all sorts of things, and especially things like blood pressure. And he said, "Well, you want to see what it does for me?" And I'm like, "Sure," because I just have never been into recreational drugs ever. When I grew up, we had a kid across the street overdose and nearly die, and that just stopped me. Because remember, I grew up in the 60s and 70s, so I was never into party drugs. I'm sorry, I'm a nerd. I just wasn't. So here we've got this really credible elder, incredibly successful business owner, you name it, he's done it. And he had what did he have? He had what's the right word? It's just drops of medical marijuana, CBD, that he had an electric cigarette for vaping. He vaped it. And I literally, over 10 minutes, saw his entire body relax, and we took his blood pressure again. It started out at 100, 160 over something. was down to 120/80 in literally just 10 minutes. So, if that's your thing, go for it. He was really trying to convince me, and I'm still resistant. I'm resistant to certain things. Okay. You can get out your wand and work with your muscles directly. That's what I do. When I have a pelvic floor flare, if I start having rectal pain, if I start having pain when I'm sitting that gets better when I'm standing up, I get out my wand and I massage my muscles directly myself. It takes about 5 minutes to calm the muscles down, and we're good. And last but not least, physical therapy. Getting back into physical therapy. If you're struggling with tight pelvic floor muscles, you can do that. There's also, for women, we can have flares the day that we ovulate and or a day or two before our period. Those are flares not worth getting upset about. It's just that change in hormones make the bladder a little bit more vulnerable. And so for many of us, like I always knew when I ovulated because I felt it. I felt that sharp pain in my ovary. It's like, all right, here's the flare. And I learned very quickly not to get upset about it. A good 8-hour flare, maybe at the most 24-hour flare, and it was done, over. I stopped getting upset about it. We can also have a stress flare during periods of very, very, very intense stress. And so when you're under stress, you go into fight or flight, right? And when you go into fight or flight, what happens? Your heart rate increases, your blood pressure increases, and your muscles get tight. Your muscles get tight. And so we also have to be a lot more open and receptive to looking at our stress levels, looking at our anxiety levels, because we have to understand that that is going to play a role in long-term symptoms. And that's probably one of the hardest things for IC patients to do, because we're really hypersensitive about how people think of us. I can remember my first urology appointment, my doctor wanted me to go to the psychology department to learn about mind-body medicine. And I yelled at him and I said, I'm peeing all night. I'm not interested in that at all. Don't tell me to go see a psychiatrist. I know what happened. We know what it is. I am peeing all night. I need help with that. But he was right. It took me 20 years to realize that he was right, because he recognized that my stress and my anxiety was completely out of control over the symptoms and over the pain. And I did not really understand, despite my master's degree in psychology, what that does to pain processing in the brain. That pain that's accompanied by anxiety, pain that's accompanied by tears, will always be intensified by the brain, because the brain thinks your life is at stake and it's trying to get your upper brain to take action. In contrast, pain that's accompanied by laughter is always minimized by the brain, because you're laughing, therefore your life cannot be at stake. So I think that that's really one of the biggest takeaways now from the last 5 years, is as we understand our subtyping, as we understand, especially for those of us, myself included, who have widespread pain, we have a history of bladder pain, bowel pain, stomach pain, fibromyalgia, TMJ, migraines, etc. If you fall into that category where you've got one or more pain conditions, the correct diagnosis for you is actually chronic overlapping pain conditions. And we know what causes that now. They had a fabulous research team came together about 15 years ago called the Chronic Pain Research Alliance. You can Google that, Chronic Pain Research Alliance. Their work is impeccable. And they were the ones who started looking at our nervous system. They started looking at nerves locally, like in the pelvis, and they started looking at the nerves in the spinal cord. And finally, they started looking at the nerves in the brain. And that's where they found the answer. Now, this is going to sound scary. It's not, and it's a very, very happy ending. But in that research, what they found for patients who struggle with one or more pain conditions, often their brain is in a constant state of fight or flight. The 24 hours a day, 7 days a week, their brain is operating on the assumption that your life could be taken at any given moment. So if you were to open your front door and see a tiger, of course, your sympathetic nervous system, which is responsible for saving your life, detects a threat. You see a tiger. It takes charge of your nervous system. It takes charge of your brain. The amygdala in your brain turns on. That's the stress center. That's this essentially the center of the stress response. What it does is it sends out adrenaline to raise your heart rate, raise your blood pressure, tighten your muscles to prepare you to fight the freaking tiger or to flee from the freaking tiger. But of course, it's 2024. We're not running from a tiger anymore. We're going to shut the door, call the authorities, say, hey, did anybody lose a tiger? There's one on my street. The authorities come out, they trank the tiger, they take it away. An hour later, the tiger is gone. The threat is gone. And at that point in time, the stress response is supposed to turn off, and the parasympathetic nervous system regains control of the brain. And what does it do? It relaxes everything, reduces your heart rate, it reduces your blood pressure, it relaxes your muscles. And normally, our brain on a day-to-day basis should be dominated by the parasympathetic nervous system. But for those of us, myself included, who have a history of widespread pain, the opposite is true. Our brain is dominated by fight or flight. So how do we know that your nervous system is sensitive? Number one, you have very sensitive skin. I love this top, by the way. This is like a fleece rayon top. Oh my God, it's so soft. I love it. I can't wear wool. No, siree. I can't even wear polyester. I can't wear textures at all on my skin. My skin is so freaking sensitive. We have a wicked sense of smell. We can smell things that other people can't smell, and smells drive us crazy. Isn't it weird that I know that some of you have a very sensitive sense of smell? Bet you didn't think that was related to this. It is. And what's a hallmark sign of a brain in fight or flight? Anxiety and catastrophizing. I had terrible anxiety in my 20s and my early 30s. Terrible anxiety. So why does this happen? Why does this happen? Well, what research shows in the children who eventually develop widespread pain, for 80% of those children, there is a history of a major physical trauma. Being hit by a car, breaking a leg, breaking an arm. I was working with one patient who, as a teenager, had a broken back, and her mom didn't believe she was in pain, made her go to school for 3 weeks. She's in agony from this broken back. Finally, she gets her to an emergency room, a terrible broken back. She has widespread pain now. So many of you have tailbone injuries. I had a tailbone injury in 7th grade, and that's at the start of when my symptoms occurred. But for the other, and also it takes 14 days for the brain to become, to develop a constant state of fight or flight. 14 days of pain switches fight or flight on for a long term. Now, for the other 20%, it's a history of bullying or abuse in childhood. And I have shared my story many, many times. I'm always happy to share it again. I grew up in a neighborhood with a young man who later became a rapist and murderer. And I was one of his earliest victims in 4th grade. I did not leave my home without fear from 4th grade through high school. And the year that I went away to college, he raped and murdered one of my neighbors. We all knew that was going to happen. We knew that was going to happen. There are many victims. We have our high school reunions, and we have our victim reunion. People still stop me. Hey, do you remember that? Oh, hell, do I remember that? That scared the living daylights out of me for decades. And I still won't talk about it. I've been asked to talk about it in major media. I still won't do it. Like, I call the DA first. It was very, very traumatic. So think about what that did to my brain. That every single school day, my brain in that morning went into fight or flight as I woke up. The closer I got to school, because we walked to school back then, the more hypervigilant I became. I was in fight or flight all day. And then it worsened again walking home because that's when I was attacked. And the only safety I had was once I was inside my front door. Decades, decades. So of course my brain became habituated into fight or flight. And that helps me understand that the things that happened to me were never my fault. I mean, I had frequency urgency in junior high. I had severe vulvodynia in high school. I developed IBS in my 20s, migraine in my 20s, bladder pain in my early 30s, along with this anxiety and all the sensitivity. And when you're the patient, you're going, what did I do, God? What did I do to deserve this life? Because I was watching my friends and family members going out on dates, getting married, and having babies. I was laying in the damn fetal position in my bathroom every morning for like 7 freaking years. Sex? No way. And when you're the patient, you're so confused and you're so depressed. Life is passing you by. And you feel like you're being punished and you feel like it's your fault. And you feel like you're damaged goods and you feel like you're unlovable and unworthy. That's how I felt. That's how I felt. And that's how that trauma affected me. But then something remarkable happened. After I got the IC, you guys all know, I had a doctor say to me, you will be a burden on your family for the rest of your life. You will live in severe pain. And that was the moment that woke me up. I know, I will prove you wrong, you son of a bitch. How dare you say that to me? And I came home and I started studying everything I could about IC. Everything. And because my favorite affirmation is be bold and mighty forces shall come to thy aid, I called top researchers in the country and in the world. The IC network, it's a direct reflection of all of that studying that I continue to do today. And then the process of that studying, what did we reveal? Number one, nerves talk to each other. Fascinating. Then, even though we were all going bladder disease, bladder disease, bladder disease, then the muscle research came out. And it's like, oh, wait a second, Jill. I have a healthy bladder wall. There's nothing structurally wrong with my bladder wall. My pelvic floor muscles were absolute toast. Why? Because I'd been in fight or flight for so long. Of course they were toast. And I had a tailbone injury. That didn't help either. And then last but not least, we now have this chronic pain research that shows what trauma does to the brain. Now, what we often see here in my office, because I love being able to be that person who can say to that younger person going through this, it's not your fault. You've done nothing wrong. I don't want you carrying any shame or blame at all. You got hurt. I got hurt. It was never our fault. And now that we understand the injury, that the injury is essentially an injury to the central nervous system, we can now do therapies that fix that. I don't live with pain anymore. Remember, I had a doctor say, you will live with severe pain for the rest of your life. He was wrong. I am pain-free. And I have been pain-free for a decade. Every now and then I have a little muscle flare, but all the bladder symptoms are gone. Almost all the vulva symptoms. No, the vulva symptoms are gone, unless my muscles get really tight. The bowel IBS, I can't even remember the last IBS attack I had. Why? Because I calmed my central nervous system down. I got my brain out of fight or flight, and I don't let it happen now. So I took a class when I was 35 years old. I used to have a lot of panic attacks. I had panic attacks before doctor's appointments. In this very house that I am living in now, my refuge from when I was a child, I am living in this house now. I would be crying in my backyard an hour before every doctor's appointment, panicking. Finally, one day, I'm like, oh my God, Jill, this is out of control. You need help. Obviously, you don't have skills you need. This is after a master's degree in psychology, right? So I went and signed up for an anxiety management class that completely changed my life. And I have not had a panic attack since I've taken that class, including going through emergency surgery for uterine cancer. So what the class taught me, so the class was really interesting. It was developed by a surgeon with anxiety disorder. And the first cool thing that happened was literally in the first 5 minutes. And of course, I had a panic attack before the class because it was at the hospital. I mean, I would panic seeing ambulances. That's how bad my medical anxiety used to be. The first revelation happened to me within the first 5 minutes of walking in the door because we introduced ourselves. And I always thought you could look at me and just see how profoundly messed up I was. That I was a walking, talking poster for dysfunction. And then I met other people with anxiety disorder. And in fact, in my class, we had the family who won the first lottery in the state of California. They were in my class. And it became very, very crystal clear for those of us who had widespread anxiety disorder, it was because we had been traumatized. And you know how badly I was traumatized. It's like, oh, wait. You mean it was never my fault? What? Wait. Wait. I was a victim of trauma. No doubt about that. Okay. The teacher said, how many of you say no to everything? Hey, Jill, you want to go out to eat? No, I have a flare. You want to go take a drive? No, won't find a bathroom. Want to go to a movie? No, I'll have to get up and go to the bathroom. Now, I legitimately wanted to do everything. But for a good 15 years, I said no to every single invitation. And I'd asked a lot of doctors, why does my brain do that? I literally want to do all of that. But the first thing that comes out of my mouth is no. And he explained that shows that your brain's trying to protect you. It's a guarding response because you're in fight or flight. I'm like, oh, okay, that makes total sense here. And then he said, okay, so you know how you're sensitive to chemicals on the outside because when you're in fight or flight for an extended period of time, it hypersensitizes everything and your skin gets very sensitive and all that sort of stuff. We get chemical sensitivity and smell sensitivity, all that sort of stuff. Okay. So he goes, you know how you're sensitive to all the chemicals on the outside? You are super sensitive to chemicals on the inside right now. And right now, you are overdosing on adrenaline. You are overdosing. I'm like, what? Oh, you have so much adrenaline in your body. That's what's driving all of this panic. It's driving the tears. It's driving the anger. It's driving the all the symptoms that you would associate with a panic attack. So he said, the way you control anxiety is you control adrenaline. If we can get the adrenaline out of your body, your entire nervous system is going to calm down. And I'm like, okay, I'm in. I'm sick of living this way. What do we do? Oxygen. Oxygen turns off adrenaline. And remember, one of the things that happens when you're in chronic fight or flight is you just have negative thought after negative thought after negative thought. Hey, Jill, you want to know? I'll have that happen. No, I don't want to do that. Our brain starts to be in this negative guarding mode. But every time you have a negative, scary thought, you give yourself a jolt of adrenaline. And you just don't have one negative thought a day, hon. You have 100 a day. It's 100 shots of adrenaline. And that's the chemical which is driving all of this panic. So again, he said, we have one goal for this first week. All we're going to do is we're going to get rid of the adrenaline. It's like, okay, how do we do that? Oxygen. So he taught us a 3-step system. So whenever you have a negative thought, the first thing I want you to do is I want you to close your eyes and just visualize the stop sign. Just stop. And the thing is that you get so used to it that you kind of ignore it, but it's also so annoying. You're kind of also saying stop too when you're stuck in this constant negative thinking. Okay, so negative thought, stop sign. Then you take a single deep breath in for 3 and out for 3. And that oxygen from that single deep breath renders the adrenaline from that negative thought chemically neutral. It is done. It is over. It will never haunt you again. So stop sign, deep breath. And then the third step is you got to remind yourself it's a thought. It has absolutely no power. It's just your brain guarding. So come up with something that you can say to remind yourself of that. So what I say to myself is, oh my God, Jill, you're not God. You can't predict the future. For all you know, tomorrow is going to be the best day of your life. Or for all you know, this is going to be a fantastic doctor's appointment. Okay, stop, sign, deep breath, minimize the thought. He said, okay, for the next week, I want you to just listen to your thoughts and do it. All we're trying to do is get rid of all that extra adrenaline. Now, chemistry made total sense to me. I love chemistry. I got 2 degrees in chemistry. Like, okay, I'm in. And of course, I had my first negative thought walking out of the room. Oh my God, this is stupid. It'll never work. But I did it. Stop, sign, deep breath, minimize thought. And that first day, I did it at least 100 times, probably more. And I was really shocked because most of my negative thoughts were about me. Oh, Jill, you're an embarrassment. Oh, Jill, you're such a disappointment. Who would love you? Who would care for you? I was really blown away at how mean I was to me. I didn't have negative thoughts about other things. It was almost always this great disappointment in Jill Osborne. So again, at least 100 times that first day. Second day, 50 times. Third day, 20 times. 5 days later, I only had to do it once. And for the first time since 4th grade when I was attacked, the adrenaline was gone. And I was shocked at how good I felt. 4th grade, all the way through to the age of 35, I was really scared. And I was stuck in this vicious loop of negative thought, adrenaline, negative thought, adrenaline, negative thought, adrenaline. And the teacher was very clear. He said, listen, we're not here to psychoanalyze you. We're not going to talk about your childhood. If you want to talk about your childhood with somebody, I'll set that up. The purpose of this class is to get you out of fight or flight, and this is how we're going to do it. We're going to get rid of the adrenaline. And that class changed my life. That's what I do. And I got so good with my negative thoughts, I might have had one negative thought a month instead of hundreds of days. And I live a very purposeful life. I live in a very happy home. You can see I always have new stuff in the background. I got some of my cat collection right there and a new plant I just bought. The drapes are open. The sun is shining in. I'm very deliberate, making sure that I've got things around me that make me feel good. But then COVID hit. And I was caring for very elderly parents. And the negative thoughts came back. But you know what? They never got out of control. Because I have my system. Stop, sign, deep breath, minimize the thought. I realize every now and then I'll let one negative thought fly. Now, if I have a negative thought, it's about an earthquake or a fire. Okay. I'll sometimes let one negative thought go. 2 negative thoughts in a row. I lock down tight every single time. Stop, sign, deep breath, minimize the thought. I have no interest in allowing my brain to start producing a lot of adrenaline. Not going to do it. And that's how I have calmed my central nervous system down. And that is one reason why I am so incredibly better. So anyway, it's sorry about going off on that. Obviously, I can talk about anything. Let's go to your questions now because I see a lot of questions happening here. We're going to start on YouTube first because we got some interesting questions over here. Yama says, I have pain in the vagina, and when I pee, I feel a little bit of relief. During pee, I had pain and difficulty peeing. After peeing, I have a burning sensation. I have to go many times to pee. Okay, so let's think about the mechanics here. And I have a picture. Hold on a sec. Let me use this picture. Hold on. So the most important question that we ask you is when does your pain occur? Before you pee, while you're peeing, or after you're done peeing? So let's just say that you've got an irritated bladder wall. Okay? These are, in some cases, especially if you have little red dots in there, these are little wounds. So as your bladder fills with urine is now going into these wounds and irritating the nerves. But once you pee, bam, urine is no longer on the wounds and you feel better. So if you have pain on bladder fill that is relieved with urination, that points us to your bladder wall. If you have pain during urination, urethral pain during urination, it's really going to be one of two things. It can be a sign of pretty severe estrogen atrophy, or it can be a sign of infection. But if you have what we call urine burn, where your urine feels really, really hot, and like it's burning you as it's coming out of your body, that's actually estrogen atrophy. That's estrogen atrophy on the vulva or on the perineum. Okay, so pain before urination, bladder wall. Pain during urination, we're going to look either at UTI or estrogen atrophy. Pain after urination, we're going to look at estrogen atrophy, but that's where we're going to start looking at muscles. So if you have no pain on bladder fill, your pain is always afterwards, then your bladder's healthy. Your bladder's healthy. Okay. Eddie said, I've been suffering with IC symptoms for the past 3 days. Can't pinpoint why. You have long COVID and was taking serapeptase, which is a blood thinner. Could a blood thinner cause a flare-up? The answer is not usually, but COVID would. COVID would. COVID-induced flares are common. We've done research with that. We knew in the second month of the pandemic that patients who had no history of bladder issues all of a sudden had symptoms very similar to IC, especially extreme frequency urgency. That is now called COVID cystitis. And when that came out, we did our own research study with COVID. We're still doing that study. Hold on. Sorry, my throat is tender. What our study found was that 75% of IC patients who got COVID flared. 25% had really, really bad flares, but the flares were short term. So when I mean short term, it's the wrong word. They lasted about 6 months to a year, but they did end eventually. Okay, Yama says, I'm taking Bladder Smart multivitamin, excellent, quercetin with bromelain and PEA 500. I'm taking only 1 capsule from each bottle at a time when it's written 2 a day. Well, you can go up to 2 a day. I take 2 Bladder Smart and 2 PEA myself every night. Diane said, I saw a pelvic floor specialist who was a doctor. He said that the nerves into my bladder didn't develop right, that the myelin sheaths are compromised, so they signal bladder pain and frequency. He said this because you've had bladder issues since you were young. He recommended an interstim sacral nerve nerve stimulation implant. Okay, so I want to read you guys something. So hold on a sec. I am currently doing our big newsletter for our 30,000 plus subscribers. Hold on a sec. Let me find it because I want to read you this quote because I think that's going to give you another way of looking at that flare. I'm not saying that he's wrong, but hold on a second. I just have to log in to my constant contact to get to my newsletter that I was working on yesterday. Oh my God, I know you're not calling me with an authorization. I gotta do the right, oh wait, here it is. Yes, I'm still working. Okay. So remember that we all for decades have assumed that the symptoms for frequency, urgency, pressure, pain were from the bladder wall. That the perception here is that patients with IC had a damaged bladder wall. So I am very blessed. I belong to all of the medical associations that work with, the urology groups and the American Urogynecology Society, things that patients can't join, but I get to join as a professional. So something happened last year that was really, really interesting. And this was with the American Urogynecology Society. They all have websites with their own discussion boards that are private. So you can't read them. Only members can read them. And so a doctor went into their forum and said, I have an otherwise healthy 44-year-old woman who's complaining of persistent vulvar irritation, urinary urgency, frequency, pressure, and burning that worsens the week before her period, and it's also worse at the end of the day if she's been on her feet. Sound familiar? Sounds very familiar. So what was interesting is another urogynecologist responded, this is classic pudendal nerve irritation from pelvic floor dysfunction. He noted that the menstrual cycle, excessive standing, walking, and of course prolonged sitting irritate the pelvic floor muscles, resulting in more compression of the nerves, and that nerve pain typically worsens throughout the day until they have the chance to recover overnight. His next quote is, this is the same nerve pain cycle that often causes bladder and urethral pain known as IC. This is the same nerve pain cycle that often causes bladder and urethral pain. Appropriately, pelvic floor physical therapy was recommended as a treatment of choice. And as I write here, so if for anybody out there, if you don't get our newsletter, it's free. Go on over to icnetwork.org. It'll come up in a pop-up window, or you can go to our news pull-down menu. Sign up for our free newsletter so you can get the latest. I've got a big issue that's going to be coming out shortly. We also just sent out another brand new clinical trial announcement on Friday for yet another new medication, which is showing great promise. And so for those of you who think that the IC movement is not moving along, let me tell you, we got fantastic research studies that are looking for patients just like you right now to try some of these new things. We have a new pain therapy too that is looking absolutely fantastic. So that's another reason to sign up for our free newsletter, is so that you can get these announcements. So again, I want to repeat it. A 44-year-old woman complaining of persistent vulvar irritation, urgency, frequency, pressure, and burning that worsens the week before her period, and it's also worse at the end of the day, or if she's been on her feet. Does that sound familiar? This is classic pudendal nerve irritation from pelvic floor dysfunction. This is the same nerve pain cycle that often causes IC. Do you understand what a massive change that is for us? And what's so exciting is that patients are finally getting better. So many of you have been on bladder treatments for so long and you're still flaring. Why? Because it's not fixing the underlying problem. Because the underlying problem relates to muscles and nerves. This is mind-blowing. And this is exactly the direction we need to go. Okay? So Diane, the one thing that I would want to know in your case, your doctor says that he thinks that your nerves didn't develop right. I want to know what the health of your muscles are. Because if your muscles are tight, that also is going to affect those nerves. And some patients have childhood muscle problems. If you were hurt in childhood, or if you were abused in childhood, that can cause a lot of this. There's a number of women out there who have vaginismus. Their muscles are so tight, they've never had pain-free sex. It's always hurt. They dread going to the gynecologist because they know putting a speculum in their vagina is going to hurt like hell. And this is also very true for men. Having that prostate exam, oh, hell no, you're not touching me. I was working with one woman. She hadn't had a pelvic exam in 25 years. It hurt so bad. She's like, I don't need pelvic exams. I never want to go through that pain again. She didn't understand the long-term consequence of tight pelvic floor muscles. That when you have muscles that are that tight, you are restricting blood supply. You are damaging nerves. And we have got to restore blood supply so your bladder has a chance to heal. And so these nerves have a chance to calm down. And once I explained that to her, she went, oh, I guess maybe I should go back. And I went, yeah, you need to go back because it's not normal to have muscles so tight that you're afraid to have sex and you're afraid to go have a vaginal exam or a rectal exam. Vita says, thank you for all your advice. My urogynecologist said you have clitoral adhesion. Sound familiar? A tender pelvic floor and inflammation in my vagina. She showed me within a mirror. It was so red. It was like fuchsia. She said it's too early to start pelvic floor and to wait until the hormone replacement therapy kicks in for 2 months for the physical therapy to have an effect. I just started Wednesday. She also told me to stop the pricey PCR test. Good. Good. She said, I have urinary issues as the nerve endings for the opening of my urethra are very close to my vagina. She like you said, it's not IC. Excellent. Vita said, the problem is I have terrible BB yeast UTI, but can't take care of it until 3 months of HRT. I really want pellets. Creams are so sloppy. What are your thoughts on HRT? Creams are the way to go, hun. The creams are the way to go because you can put the cream where you need it. So you can put the cream in your vagina if you're having vaginal discomfort. You can put the cream on your vulva if your urine feels very hot, like it's burning you. And if you're having urethral pain, you can put it at the entrance to your urethra. I agree, it's a little bit messy, but I do mine at night. And I tend to focus more externally than internally because I'm not in a sexual relationship right now. Not that I wouldn't want to be. Hint, hint. So I would be doing more internal if I had the chance of actually having sex right now. But, you know. Vita says, I get yeast infections every time I'm on HRT with the creams, especially given my other issues. Well, understand, hun, that yeast live on sugar. I mean, candida fungal infections are a very big, major medical problem right now. And they're becoming very, very drug resistant. They are considered candida, drug-resistant candida. It's one of the top 10 pathogens affecting humanity around the country, and they have been surging in the last year or two. So you kind of have to understand the life cycle of candida and fungus, because candida love warm environments, and your vagina is a nice warm environment. If you're sitting on a warming car seat, that's bad, because that's creating heat exactly where you don't want it. And so you're creating a nice environment for fungus to grow. But also, yeast need to eat. And what do they eat? They eat sugar. And so one of the things that I learned very early on, when I had a drug-resistant candida infection for 2 years, back 20 years ago or 18 years ago, somewhere in there, my yeast always flared if I ate ice cream, anything with milk sugar, or if I ate pasta. So I would recommend that you read the book, The Yeast Connection, which talks about that, because we have got also to make sure that we're not accidentally feeding that yeast population. Diane says, the doctor checked my pelvic floor and said they were weak instead of tight, so I wasn't a good candidate for pelvic floor physical therapy, and that the InterStim was the way to go. I disagree with that, and I think most physical therapists would disagree with that, in the sense that if your pelvic floor muscles become so weak that you start to develop a prolapse, things start to fall out of you. InterStim is not necessarily going to. It's a good question. Normally, when you have weak muscles, you want to get into physical therapy very, very quickly, but you're going to focus on Kegels, which is the exact opposite thing that we do when we have tight pelvic floor muscles. Patients with tight pelvic floor muscles have pain when they do Kegels. But if your muscles are very, very weak, then we're going to go with doing something like a Kegel to strengthen those muscles, because you don't want that weakness to progress to the point that you're starting to suffer a prolapse. We're going to do everything we can to try to help these muscles get stronger. And so I think you want to make sure, I would talk with a physical therapist about other things you can do, and also getting a sense of the condition of your muscles. How weak are they? Sometimes muscles get so weak and get so stretched out that Kegels won't work, and that's when we're looking at surgery. So I would still want a muscle expert to be involved in my care, but that's me. Diane, you can always try it and see how you go. We have a lot of information on InterStim on the IC Network website. I happen to run the support group where InterStim was developed, so I've been involved with InterStim from day one. And I will tell you, the early days of InterStim were very, very, very difficult. So InterStim is a form of neuromodulation. And the theory is if we gently re-stimulate these nerves in a very mild way, that we can get them functioning correctly again. That said, there are many, many potential complications with InterStim. So come on over to the IC Network website, go to our treatment area, and make sure you read through the neuromodulation section, because it's not easy. It's not necessarily easy. And there are two different ways of doing neuromodulation. You can do the surgical neuromodulation, InterStim, or you can start with the ankle stimulation known as urgent PC. They target the same nerve. One takes surgery and one doesn't take surgery. So back in 1993, I was referred to UC San Francisco Urology, which is where they developed InterStim. So that's where InterStim by Dr. Tanago and another doctor, they were the ones who actually created the InterStim device. But I was sent to a different urologist named Dr. Marshall Stoller, and he created the ankle stim because he was kind of appalled by the experience that the surgical InterStim patients were going through. He said, guys, You don't need the surgery at the spinal cord to do this. You can actually capture that same nerve right down at the ankle. And so what they do is they insert a acupuncture needle as a vector to the nerve above the ankle, and they attach a TENS unit to it and turn it on. And I had that done. I have tattoos on my ankles from it. Let me see if I can show them to you. Hold on. Is it this foot? No, let's try this foot. Yeah, okay. I don't know if you can see that or not. There's a little black spot right there. You probably can't see that. So it's 3 finger widths above the ankle bone, and it's 1 finger width below. And this goes to the SP6 acupuncture point. And by my 4th treatment, I had my first 2 hours without pain. By my 7th treatment, I had my first day without pain. No surgery necessary. That broke me out of a year-long terrible, terrible flare. So again, come on over to the IC Network website and please read our section on neuromodulation. Also, I just want to emphasize 2 very, very important points with surgical neuromodulation. Always go to the MOD database on the FDA so that you can see in real time the hundreds, if not thousands, of complications reported with InterStim as compared to 1 reported with the ankle stem. And we can do that right now. I can go there right now. We can just read through the last couple just reported at the end of December. There's a decade's worth of research there. There are many, many serious complications with InterStim. Drug-resistant MRSA infections being very, very quite common. And number 2, if you're really going to go that direction, and I'm not against it, listen, InterStim can change lives, especially patients who have incontinence. If you are incontinent from your bladder or incontinent from your bowel, absolutely, InterStim can be life-changing. But you got to have your eyes wide open about the potential risk. Some doctors make it sound like it's easy, but there are a lot of well-documented complications. And last but not least, always, 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 always get in writing from the insurance company that it is covered. We had a patient, a nurse who was back in Appalachia. There were 3 urologists in town. They all said, you need InterStim. She didn't want to do it. She felt like she was being forced into it. She was pretty smart, though. She went to the doctor, urology office, talked to the billing department. Is this covered? They said yes. She went to the hospital where she was a nurse and went to the hospital billing department, asked them, is this covered? They said yes. She called the company, the health insurance company directly. Is InterStim covered? They said yes. She did not get it in writing. A week after surgery, she had a bill for $70,000. So always make sure that it is covered and get it in writing first. They threatened to garnish her wages. Eddie said, can male ejaculation cause IC or pelvic floor? Yes, absolutely. It's very common for men with pelvic pain to have a severe flare the moment they ejaculate. Why? Because that's when the strongest pelvic floor spasm happens. And so that can be fixed with pelvic floor physical therapy. All right, now we got to come back to Facebook. Now, listen, you guys on Facebook, you've been freaking awesome waiting while I was answering questions on YouTube. I want you to know that Facebook sometimes does not let me scroll back. And so if you asked a question and I have not answered it, please don't take that personally. Please ask it again, okay? Because you can tell it's a dynamic environment. Okay. So it's only letting me, how long have we been going? We've been going an hour and it's only letting me go back 36 minutes. So Sue says, your knowledge about anything pelvic floor pain is more than any doctor I've ever seen. I've seen a lot of them. And if you people on this website find another website where they're asking you to pay for this knowledge that Jill shares for free, run the other way. There are people out there that will gladly take your money and promise you that they will cure you before they even. Okay, guys, I want to re-emphasize this point. You do not have to pay for this information. There are people out there right now who are saying, hey, if you take my class for thousands of dollars, I will teach you how to heal or cure your IC. Come to our website, go to the ICA website. You don't have to pay for that info. You're not paying for this support group meeting. And most of you, when you call me, you don't pay. We do have coaching. I would never charge thousands of dollars for that. I charge $50 for 30 minutes. You know, but that's a tiny fraction of the people who call. The vast majority of patients who call are free, and it's fine. This is my job. I want to do it, but it's breaking my heart that people out there are paying thousands of dollars for information that we have gathered for decades, and it's free. You know, when the IC network was started 30 years ago, I got to tell you, I was not welcome to the IC world 30 years ago. And the IC world was dominated by the ICA. I was an ICA support group leader, but I wanted to bring support to patients who were homebound. They were not interested in that at all. I got a lecture on knowing my place when I proposed building them a website on IC and building them an online support forum. They laughed at me and said it would never work and it was a stupid idea. And that's exactly how the IC network started, because I felt it was important. But for many, many years, people tried to discredit my work by saying I'm profiting off the patients. And I kept saying, how? It's free. How am I profiting off a patient? And 30 years later, that website is still free. Now, I can tell you, before Facebook, we had 200,000 patients a month using our website for free. If I had charged $5 a month, I would be a very wealthy woman right now. But I didn't do it, which means my retirement fund is tiny. But my goal was always to bring information to patients who couldn't afford it. So this is kind of a sore button for me anyway. So listen, everybody needs to make a living. Everybody's got to do what they feel is right to make that living. And in my opinion, I'm incredibly disappointed. I can understand taking a class for $100, $200. I can't understand $1,000 or more class. I don't understand that. Sue says, I've had bladder pain for 40 years and there's no one out there that has a better understanding of what causes bladder pain than Jill. If anybody tries to sell you something that says they're going to cure you on TikTok or Facebook, run the other way. Carol says, have I heard of the LEVA system? L-E-V-A. L-E-V-A. Is that a typo? Hold on. The LEVA pelvic health system. New 6 to 12 months follow-up study shows the LEVA is clinically superior to Kegels alone with durable results that last at least a year. And it's covered by Cigna. So this is for people who have weak pelvic floor muscles. Interesting. It's levatherapy.com. I don't know anything about it, but it is interesting. Jackie said, what do I think of Botox in the bladder? Botox is a way of silencing nerves that might be dysfunctional, driving some of that frequency urgency. They can also do Botox into pelvic floor muscles. You just have to understand the ramifications, the potential risks of Botox. In the bladder, where they put it matters, but you can't necessarily see the nerves. So if a doctor accidentally injects the nerve which controls your ability to urinate, you might have to self-catheterize for a period of time after you do Botox. You won't be able to pee on command until it wears off. So that's one of the very legitimate risks of Botox therapy in the bladder wall. You don't have that same therapy if it's used in the that same risk if it's used in the pelvic floor. Julie said, yes, my gynecologist told me vaginal atrophy. Julie said, I had my bladder removed age 52. Surgeon said 8 out of 10 IC, but I still have vaginal and bowel issues. Okay, so so we know we have to work on those muscles and nerves, Julie, right? Amanda said, I thought my flare was from pelvic floor, but I had pain on bladder fill. Amanda, when muscles are super tight, the bladder does get sensitive. That's called ischemia. And so that's, that's kind of the surprise is patients who have tight pelvic floor muscles will have bladder wall sensitivity because their bladder is so compromised. They just don't have good blood supply. Again, if your bladder is only getting half of the blood supply it needs to be healthy, are you going to have a healthy bladder wall? The answer is no. If your muscles are so tight, they're restricting blood flow significantly, then your bladder is not going to be getting the nutrition and oxygenation it needs to be healthy. It's that simple. And so you are going to have bladder wall sensitivity. I had terrible bladder wall sensitivity. The difference, though, was bladder treatments never worked for me. Whenever they looked at my bladder, I had a normal, healthy bladder. Why? Well, for me and for the great majority of patients out there, it's because we have an underlying neuromuscular disorder as compared to a bladder wall disorder. So when people, people get, and like I was legitimately confused, why do I have a healthy bladder when I can't sleep at night? And they would say, it looks good to us, Jill. We don't know what's wrong. Well, what's wrong? I can't sleep. Please help me. Well, now we know what's wrong or what was wrong. That it really legitimately was never my bladder wall as being diseased. My bladder wall was being victimized by very tight pelvic floor muscles caused by long-term fight or flight and by a tailbone injury. And again, I was just gobsmacked. I hadn't drunk lemonade in 30 years. And last May, I got COVID. And I was coughing so violently. I mean, it was the last time I saw my mom alive, actually. I started coughing in the hotel room, in the hospital room. And I couldn't stop coughing and I was gagging and I had to run into the bathroom. And I just had to kiss her and say, I've got to go. I was just gagging. It was so bad. And as I'm driving home, I'm going, oh my God, this is so bad. What do I do? Hot lemonade with honey was my only idea. I stopped at the store, got lemonade, got honey, got home, made it, didn't flare. I've been drinking lemonade ever since. I have not flared from it. There's lemonade in this right now. Now it's diluted lemonade. Why can I now do all these foods? Because my bladder wall has healed because my muscles have healed. That's why. My ischemia no longer exists in my pelvis. Jackie said, are pelvic floor exercises okay for hunters? Well, pelvic floor exercises are not going to fix hunters. But if it'll get your muscles to relax because you're in so much pain, sure. Joseph said, I have IC, but I feel infection, but in the test, there's no infection. It is constantly irritating. Joseph, that's very, very common where you feel like an infection all the time. You have to understand that bladder only knows one language: frequency, urgency, pressure, pain. Okay, the only way that the bladder can tell you that there's a problem is through these symptoms that you associate with infection. But those are the exact same symptoms that happen if you're shot, if you have a bullet wound or a stab wound, or if you have tight pelvic floor muscles restricting blood supply. So yes, it feels like infection, but if those tests come back negative, it's not infection. That means for the great majority of us, it's a muscle issue. And I'm going to say for 90% of the guys out there who have this, it really is a muscle issue. And that if we go back in time and look at your history, were you riding dirt bikes, you were riding bicycles, were you playing ice hockey, gymnastics, anything where you took falls or traumas, pelvic traumas, were you playing football players? Yay, 49ers. Okay, sorry, Keeling. You know, for guys and particularly, for guys particularly, we have to see, we often see just a history of pelvic trauma, and we see a lot of tight pelvic floor muscle. And so that pelvic floor physical therapy is just so incredibly important for guys, and men are condemned. I mean, the tragedy for the guys out there is that many doctors assume that a guy with frequency urgency has a prostate problem. And so before you know it, you're on long-term antibiotics and you're on prostate meds and you never get better. And even getting them to look in the bladder is hard because they always assume prostate, prostate, prostate. But then when they go actually look in the bladder, that's like a healthy, normal bladder. What gives? We had a very interesting study come out like 3 years ago of men with chronic prostatitis, chronic pelvic pain. 70% of them had an underlying hip problem, and they were sent to orthopedic. So we now really recognize that the great majority of men diagnosed with chronic pelvic pain syndrome, chronic prostatitis, it's really not prostate at all. It's related to muscles and nerves. And I will tell you also that I'm currently serving on the AUA guidelines committee for male chronic pelvic pain. And we have the best doctors in the country coming together to work on this guideline document. And it's very, very clear from all of these experts that it's really rarely a prostate problem for men diagnosed with quote unquote chronic prostatitis. It's fascinating. So good things happening for guys too. If you pop me an email icnetwork@mac.com, I've got a fabulous list of articles for men that I send to every man that contacts me. And I'd be happy to send that to you so that you can look at some of these incredible success stories of men with physical therapy and other muscle and nerve intervention. Paola says, I'm feeling a lot better taking estradiol and fesoterodine, but sometimes I feel spasm down there. I don't know how to explain it. Also, do you recommend any specific lubricant? December, I was feeling better after traumatic October and November pain, and I had intimacy December. The pain came back a day after, not as bad as October and November, but it was enough for me to know maybe I'm not ready to have intimacy with my husband soon. Well, lubes are really kind of what you like. I'm a KY girl. KY works for me perfectly. Some patients like slippery stuff. Some patients like coconut oil. You just have to find one that works for you. But plain, not a lubricant that has heating properties or that smells good. I mean, that simple generic KY ointment to me is perfect. I use it regularly. Sue said, I'm standing at the stove right now making dinner and my calm time went off. I realized that I've been clenching my butt cheeks while doing this work at the stove and standing with my pelvis tucked in. Now I'm consciously relaxing because you just don't become aware of doing it all the time when you have pain. The Calm app is amazing. I have it too, but I tend to ignore it and I probably shouldn't do that. Lily says, I'm going to pelvic floor physical therapy for months and PT sent me back to gynecology to discuss pelvic floor trigger point injections. Excellent. I'll have them in a week. Excellent. I'm hoping that these help me with pain trigger points with physical activity. Even gentle yoga makes me flare up. Do you think it'll help? Absolutely. Definitely worth trying. I have been trying to get trigger point injections for my neck because I've got this ginormous trigger point. I've had it for years after from bad whiplash from a car accident, And Kaiser Permanente does not do trigger point injections, and I'm furious about it. I mean, sometimes, see, it's right there. I can feel it. It's like the size of a big almond. Carol said, my nutritionist said she thinks my IC is aggravated by candida, but I have a sweet tooth, so it's so hard to stay away from sugar. She suggested homeopathic drops to get rid of candida, but I haven't started taking them yet. Do you think I should start them? I think that you've got to learn a little bit more about how fungus grow. Because the long-term consequence of your sweet tooth on is you're just feeding fungus. The human body is not designed for the high levels of sugars that we're exposed to in today's modern environment. For me to get my candida under control, I stopped eating candy. I rarely, if ever, eat candy. I will do some white chocolate around Halloween, but between trying to keep my teeth healthy and never letting candida take control, I'll do that. Lori said, hey, I bought the Bladder Smart multivitamin. My urogynecologist said because of the vitamin C, I shouldn't take it. What do you think? I have IC and want a multivitamin. The Bladder Smart multivitamin uses the low acid form of vitamin C. It is not ascorbic acid. It is calcium ascorbate. And so many patients use the Bladder Smart low acid multivitamin very, very successfully. And I do myself. I think you can give it a try, but it's never my job to get between you and your doctor. The patients who tend to be sensitive to any multivitamin, even the low acid multivitamin, are going to be the patients with Hunner's lesions. So you won't know until you try it. Now, the advantage of the Bladder Smart is not the first low acid vitamin. Low acid multivitamin was actually my idea. I was talking with the CEO of a company called Far Laboratories, and he just asked, this probably 15 years ago, he said, Jill, if you could make anything for an IC patient, what would you make? I said, I know exactly what I'd make. I'd make a low acid multivitamin. And he said, why? And I said, because every day people call and say, is there a bladder friendly vitamin? And the answer was no back then. And flares from those big brand names were very, very common. Why? Because they use ascorbic acid derived from citrus. And that's just too acidic for somebody with a sensitive bladder. So he was like, oh, that's interesting. Well, 6 weeks later, he called me back and he said, hey, we decided to try to create a multivitamin for you. It was called Multirite. And because I had flared myself from Centrum and Wenadase back then, a vitamin scared me. And in fact, I let other IC patients try it before I tried it because I was so sensitive. But I just cut it. It was a big horse pill back then. And it's a hard pill to swallow. So I would cut it in quarters and I never flared from it, but it was just too big. It was too hard. And so I went to Natural Approach Nutrition and I said, can you make us a low acid vitamin that will be easy to swallow? And he said, yeah. And so what they did instead is they put it into capsules, 3 capsules. And you can titrate. You can start with 1, which is like a third of a typical multivitamin. And you can go up to 2. And then back then it was 3. I think the formula might have been changed to 2. I don't remember off the top of my head. But we've been absolutely tickled with the success of the Bladder Smart low acid vitamin. And now other companies are following along and creating their low acid vitamins. But the Bladder Smart is, in my opinion, the best low acid vitamin to try. And you won't know until you try it. But again, it does not contain ascorbic acid. It uses calcium ascorbate, which is basically a buffered vitamin C. And it contains calcium glycerophosphate as a source for calcium. And calcium glycerophosphate is the active ingredient in pre-leaf, which reduces acid. And so it's using the low acid form, and then it's also using a very specific ingredient to minimize any other residual acids. So the Bladder Smart multivitamin is available on the IC Network website. Just go to icnetwork.org and click on our shop, and you'll see it right on the cover of our store. Let's see, hold on a second. Paula says, you're amazing. You're an angel, since especially after you hear your doctor say there's no pain. Yeah. Hey, you know what? Listen, we have to embrace our inner warrior here. I don't know if I would be here if I hadn't had a doctor say you will forever be a burden on your family. I was absolutely in a very terrible place emotionally. And as cruel as it was for him to say that to me, it's what motivated me to start fighting for my life. And I'm grateful for that moment because number one, it's given me work that I'm very, very proud of. But number two, you can't be passive in your healthcare. You have to be active and informed. You got to know how your bladder functions. You got to know how yeast grows. You got to know all of this stuff. And that's a big problem that we have right now is that people aren't reading anymore. People want it in short form video. You'll never get this info in short form video to the degree that it will really help you. That's why we have the largest archive of IC information over on our website. And I've shortened it and I've made it super simple to read, but you've got to read. Some of you don't know where your urethra is. Is it in front or behind of your vagina? There's nothing to be ashamed about with your body. God gave us this body. It's a precious. It's what keeps us alive. And we have a job to keep it as healthy as we can. And so if you don't know what your bits look like, get a mirror and look. Don't be proud. This is a beautiful body that's wired to heal itself. 24 hours a day, 7 days a week, your body is trying to repair whatever's happening to it. Our challenge is we get in the way. And we get in the way with bad nutrition, eating a lot of sugar, all sorts of stuff. Sometimes a diagnosis of IC is a real wake-up call because it's at that point in time, usually in your late 20s, early 30s, where your body's saying, Uncle, please, I can't help you anymore. That when you were in your teens and you drank several diet sodas a day, and in your 20s, it was diet soda and coffee all day, eventually your bladder's going to go, help me, because your bladder is literally not designed for that level of acid. And so getting a diagnosis with this is a bit of a personal reckoning to clean things up and to make better decisions about your health, to eat better. What's interesting about this cold flu thing that I had is that I was gagging a lot. Just having this esophageal spasm, but it was related to the sore throat and it was so weird. And my best friend had it and she was just vomiting. And I just don't vomit, knock on wood. I was gagging and it was awful. And so what did I do? I backed way back on my food. Normally I would eat like unsalted tortilla chips and stuff like that. And I just started making really good, healthy food again. And my goal here was just to calm all the nerves down because we have to take responsibility for our body's behavior. We have one job: to create an environment to support healing. That's it. Physically, mentally, and emotionally. You don't have to live and suffer. There's hope. We can get your body in a better place. We can get your emotions in a better place. And there's no shame in any of this. Life is hard. And it's hard right now. It's very hard right now. I mean, we all have PTSD from COVID. And now we're going through election PTSD. And I don't know about you, but like I have like no interest in being on social media right now. I do not want to go what we went through 4 years ago, where all these friendships were broken as people were yelling at each other and people were fighting with each other. That's not a safe place for me to be. And so I'm reading more, I'm painting more, I'm playing games more. I want to be happy. And I know that a lot of social media is just not a happy place right now. And I don't need to see sad things every day. I know they're happening. I have to take responsibility for my mental health. And my mental health means not to scroll through Twitter. I refuse to say the other name, or Facebook, or Instagram to any great degree. I take a step back and breathe and get out and walk and get in nature. Judy says, I use 12 grams of a compounded vaginal cream twice a week. Can I increase that to 3 times a week? Is there an OTC cream that I can use on the other day? Judy, I can never give you medical advice like that. You have to ask your doctor if that's okay. In terms of an OTC cream that you can use on other days to keep your vulva moist, yes, there's something called Vulva Balm V Magic. I have it. So this is what the bottle used to look like. Medicine Mama's V Magic. And let me just show it to you. This is as close to the natural consistency of human mucus of any product out there. And so look, you can see it on my finger. It's not sticky. It's not thick like Vaseline. It's very, very close to the normal consistency that you would find on your vulva. And so lots of women use this very, very successfully, but they just renamed it. This is an old demo. I mean, I've had this tub for probably 8 or 9 years on my shelf. I can tell. So the new one, the new name for it is a Vulva Balm V Magic organic formulation. And they now have an embossed vulva on their package, which is cool because we're not going to be embarrassed to the human body. So let's see what this looks like. So now it's in a different container. And you know what? Let's just open this up. So this is made with an organic olive oil, avocado oil, sea buckthorn oil. Oh, yeah. So it's a slightly different color. Well, let me look at it. Oh, it's just a little bit darker than the old one. This, again, I've used as a demo for many, many years. It's got to go. Into the trash it goes. This is my new demo. So let's try this. Ooh. Ooh, even better. Wow. Oh, wow. No scent to it. Feels good. Yeah, so if you're dry down there you go. Medicine Mama's Vulva Balm. I have a new product that I'm going to work on. It's going to be kind of similar to this that I hope to make, but I don't have that right now. So we sell a lot of that in the IC Network store. Jackie said and you can use it every day. You could use that every day. And there's some women who cannot use estrogen for one reason or another. You got to keep that skin moist. And it's not a water-based moisture. It has to be hydrophobic. It has to push water away. That's why it's in an oil base, but very, very light oil. Jackie said, is Gemtesa effective for urgency? Don't get a lot of reports about it. I'm not sure. Aaron says, when I flare, I have a horrible time getting urine out. Well, that means that your muscles are very, very tight. So that tells me you're having a pelvic floor flare more than likely. Carol says, the Leva system is supposed to help with incontinence, and I was told it's supposed to help with frequency urgency. It was not covered by insurance, and it costs $1,200. They'll let you pay $100 a month. And if you use it 30 days in a row and you don't feel like it's helping, they'll refund your money. That's good. But in having a hard time doing it every day, it feels like you're doing a Kegel exercise, which wouldn't help if you have tight pelvic floor muscles. I've gone to pelvic floor physical therapy twice, so I was told I had tight pelvic floor muscles. I probably shouldn't be using it. I agree. Over on YouTube, Diane says, if interstim or the ankle stem works, would acupuncture help too? I'm not big on acupuncture, to be quite honest. The American Urology Association guidelines for IC encourage you to give acupuncture a try. I will tell you that, again, I'm a central sensitization patient. I did whole body acupuncture once, and it was way too much for me. Way, way too aggressive for my super sensitive skin. But I've been encouraged to do acupuncture for my neck, and who knows? I mean, my neck is just always so tight. It's just ridiculous. Gwen says, are you going to update the food list? What about okra, cottage cheese, sour cream? Cottage cheese should be fine unless you're struggling with fungus. Sour cream, not really worried about that. Okra, I have no idea. You guys, my to-do list is so massive right now. It's so massive. And that's been on my to-do list for a couple of years. I was consumed caring for my parents. And now that they passed away, I'm consumed by grief. And so I'm slowly getting more done. And I'm finding my center again. But I appreciate your patience. I wish I had a twin and that we could work. So what am I working on right now? So we're doing the AUA guidelines. We're doing the International Continence Society Masterclass on pelvic pain. I do a lecture a month or every other month to an international group of doctors. I'm working on a masterclass on IC. I'm doing a ton of clinical trial recruitment right now. We're working on a brand new product with another company that I can't tell you about that I'm super, super excited about. And most of all, literally every day, I'm talking with patients on the phone. Yama says, on January 25th, I have an appointment with the doctor. Can you please tell me what I have to say? Also, guys, we're starting, I'm getting all the windows replaced starting Tuesday. We have a monster storm coming in tonight. So I am probably not going to be that available by phone this week. I will try. I will have my cell phone, but there's going to be a lot of noise. We're finally replacing single pane windows with double pane windows. Because honestly, it's cold as hell and I can't afford the power bills without it. Last year, our power bill in January was $930. Because my dad always put the thermostat up to 72 or 73. I paid the power bill for 30 years. And he finally is like, I can't afford $1,000 a month, Dad. You're either going to have to put it back down to 65 or you're going to have to take over paying it. And he had a nice retirement. He easily paid it, but I can't afford that. I can't afford that. The windows have to be replaced. Gwen said, I saw the email that I sent out for the trial. You can't find where it is, what state. Gwen, you have to fill out the form, the email that I sent out Friday for the OAG 1050 IC study. That's our first blast email on that. When you click on that list, it will send the link. It will send you to a website where you take the survey, and then they'll tell you. So please do that. For anybody out there who got my email on Friday and you're interested, please click on the link and go look at the questions. Because you never know, this might be a treatment that you might find very, very helpful, and it's freaking free. And I'm saying freaking a lot today. I apologize, but at least it's not the F-bomb. I'm 63 years old, guys. Seriously. I'm going to let it fly if I need to let it fly. All right. Peggy said she tried the pelvic floor exercises on our website. Can you tell me where to find them? We have a wonderful pelvic floor relaxation series on the IC Network website in our free download area. So if you go to the IC Network website, icnetwork.org, go to the IC pull down menu, the very bottom, it says free downloads. You'll find a lot of free downloads there, including our free pelvic floor relaxation guide. All right, hold on a sec. Does biotin affect the IC bladder? I don't think so. Sue said, recent news about plastic water bottles and the amount of plastics that are actually getting into our system is not good. Most of us only drink spring water. The bottled water in glass bottles is so expensive. My city water has too much chlorine in it. Not sure how I feel about this new research and what would be an alternative to drinking 6 to 8 bottles of water I drink a day that are in a plastic bottle. You know, back in the day, we actually had water companies that came and brought water. You could get a better filter that would filter out some of the chlorine in your city water. We have great city water here where I live. And I will tell you, I had replaced all of my glasses that you drink out of about 10 years ago with acrylic because my parents couldn't hold them and they kept dropping and breaking. I just threw all of those out this week because of that research too. And I'm back to drinking out of glass bottles, and I've got my travel water bottle that I sometimes use if I remember to use it. I'm trying not to use plastic at all anywhere. I also got rid of my plastic wrap in my pantry, and I use foil now for everything because you can recycle foil. Gwen says, I have big girl pants. I can handle your language. Good. Diane says, would Botox be better and less invasive than InterStim to help with nerve problems? Yes, it would be. There, back in our old treatment rating scale, they were both labeled as step 4 treatment options. Before our new guidelines that were released last year, we had 6 steps of treatment, and the steps were arranged with the risk of adverse event. So they wanted you to start at step 1, do everything in step 1 before you go to step 2, do everything in step 2 before you go to step 3. And they wanted you to start the easy, less risky stuff first. So both InterStim and Botox were in step 4 because they both come with potential side effects. But the potential side effects from InterStim are really significant as compared to Botox. The biggest side effect of Botox is if it numbs the nerve, which controls your ability to pee, you might have to use catheter. Whereas the biggest side effect with InterStim would be, devastating MRSA infection. Hello, Kim from Western Kentucky. Yelma said, I have an appointment with my urology doctor. Can you please tell me what I have to ask my doctor? Well, Yamo, what I want you to do is I want you to walk in with a list of your symptoms and do a avoiding diary for a couple of days so that he can see easily, he or she can see how often you're urinating. But the devil is in the details here. The diagnosis is really often confirmed by what your symptoms are. And so I want you to really think about, like, when does your pain occur? Before you urinate, during urination, after urination? What does the pain feel like? Is it sharp or dull? Is it achy? Does it ever shoot down your leg? Do you ever have pins and needles? Do you ever have areas of numbness? Is your pain, where is your pain located? Is it inside of your body or the skin on the outside of your body, on your vulva? Where is it located? Is it to the left? Is it to the right? Or is it centered? That's all explained over on the IC Network website. And in my book, IC 101, It's Not Just a Bladder Disease. We have the whole thing on first appointments and the things that you can do to prepare for that first appointment. So go on over to the IC Network website and read what I've got over there. And then if you want more information, you can get the Kindle version of our book, IC 101, and that's $9.99. And you can look at the first appointment information there. Okay. Deb said, I'm scheduled for my 5th distension with fulguration on my Hunner's lesions. I was diagnosed in 2019 and then averaged about 12 months in between each treatment. I always feel less discomfort after the initial healing process. As my lesions return, my pain level escalates. I think that this is my new normal. My doctor has discussed using a portion of my intestine to augment my bladder. I'm holding off for now. So Deb, a couple of comments. Question number one is, what causes lesions? This has been the big mystery in the ICU world, is why do lesions occur in about 5% of ICU patients? The rest of us don't have lesions. You do. You have an open wound in your bladder. And we have our subtyping system. Hunner's lesion patients are in their own distinct group. And really, from worldwide, among the top IC researchers, pretty much everybody believes that Hunner's lesions is its own disease, and it should be called Hunner's lesions disease rather than IC. Or if you're in Europe, if you have Hunner's lesions, you're diagnosed with IC. If you don't have Hunner's lesions, you're diagnosed with bladder pain syndrome. Okay, you are a distinct patient. When they biopsy lesions, they find massive inflammation. When they biopsy my bladder, there's nothing there. So what is inflammation? Inflammation is basically a biological war, right? That means there's a war happening in there. Your white blood cells are in there and they're trying to kill something. So we have two prevailing theories about what causes a lesion. Theory number one is that it's a nerve that's very, very inflamed. Nerves that become inflamed release toxins. They release something called substance P as in Paul. And substance P is very damaging to tissue. So we have one fascinating case study which supports that. But our other cause is the one that's far more likely. But let me explain this one first. So we had a woman, this was a case study written up in a major journal a couple of summers ago. So she had severe Hunner's lesions and she had a very bad prolapse. And because she couldn't urinate, they decided that they needed to go in to repair the prolapse. And when they did that, they made a remarkable discovery that her uterus was backwards. The front of her uterus is facing backwards. The back of her uterus is facing frontwards. Why? Because one of her ligaments was broken. One of the ligaments that normally holds the uterus in place was broken. So her uterus was free swinging with around one ligament. This is called posterior fornix syndrome. And I've got an article on it on our website, and it's like a remarkable cure for patients with Hunter's lesions, and I just gave it away. Okay. So anyway, what did they do? They restored it. They got the back of her uterus frontwards, and they restored the ligament so that her uterus was now properly in place. And something absolutely remarkable happened. Her Hunter's lesions healed completely. She is considered a complete and total cure. So basically, that's a perfect example of a nerve injury, because with this strangulation, the tissue is twisting, and that's compromising blood vessels and nerves and causing all sorts of problems. So when they stopped that, the nerves calmed down and the lesions apparently went away. And again, you can actually find that case study on our website. It's really quite exciting. So posterior fornix syndrome. The posterior fornix syndrome is very easy to diagnose. And actually, if you go back in time and you look at the literature from 30 or 40 years ago, these researchers were saying, hey, this can cause bladder symptoms. This is the first time in 30 years I'd ever heard anybody talk about posterior fornix syndrome in an IC context, but they've been warning about it for years. So they can easily check you for posterior fornix syndrome by inserting a little wooden speculum in your vagina by your cervix and lifting up where that tendon should be. And if lifting that up resolves your symptoms, you've got posterior fornix syndrome. So again, you can go over to the IC Network website and just search for posterior, and then it's fornix, F-O-R-N-I-X. Let me, I can write this in here. Okay, so that was very, very cool and exciting. But that's that's fairly random. So our other theory about Hunter's lesions is actually supported in many research studies. And that is that it's a virus. That it's a viral infection of the bladder wall. So it's researchers in Europe who 8 or 9 years ago were studying the urine of patients with lesions and comparing it to the urine of patients without lesions. And they kept finding a specific virus called the polyoma virus. The polyoma virus is a virus we all have. It's normally silent, but it gets turned on in patients who are immune compromised. So polyoma has been directly correlated with something called hemorrhagic cystitis. So hemorrhagic cystitis often happens in patients who have gone through a transplant surgery where they're on immune suppression drugs. And when you suppress the immune system, the virus turns on in the bladder wall and starts infecting the bladder wall and causing the bladder wall to bleed. So we have multiple studies now who have found 3 viruses actually, polyoma BK, B as in boy, K as in Kelly, polyoma JC, that's J as in Jill, C as in cat, and then Epstein-Barr, the virus of mononucleosis. So we have all this research coming from Europe, and we're like sitting here talking about it, waiting for somebody in the American system to comment. It's like our IC researchers, guys, what do you think about the viral theory? And they said nothing for 5 years. And it was very frustrating for me. It was very frustrating for a lot of us because is this crazy or is this credible? Well, what we didn't know is that they were doing their own viral study at the National Institutes of Health MAP Research Network, where they happen to have a lot of urine from many patients stored over time. Hundreds of patients have donated their urine over time so that they could study IC. So our top IC researchers went and looked at that urine, and you know what they found? Polyomavirus in about 5% of patients. So this is no random theory from a unknown researcher in Europe. This is now supported in multiple research studies, including by the US National Institutes of Health IC research team. And last summer we had, oh, and I should say, why do we know this now? We know this now because we have new types of testing available, specifically next generation DNA urine testing, which allows for a closer look at what's in urine. It can look at bacteria, it can look at fungus, and depending upon the type of test you do, it can look at virus. So, this summer, we had the first publication of a study that tested an antiviral medication. So with patients with Hundred's lesions, they did next-gen testing. They looked to identify virus, but they were looking for Epstein-Barr. They found a lot of Epstein-Barr. And those Hundred's lesion patients where they found it, they gave them an antiviral, and it was successful. So you can read about that research on the IC Network website in our Hundred's lesion area. I can give you more information because there's new research that I haven't updated on our website yet. So what I think I would do is I would ask your doctor to do a blood test to see if you have any active viral infection. And if you do, that would help us understand why your lesions keep recurring. Now, current treatment protocol for Hundred's lesion is a steroid injection to calm the inflammation. That makes sense for the neuroinflammation component. Doesn't make sense for a viral, but it is what it is. It's a very easy, very, very easy treatment that doesn't leave scarring. They can cauterize the lesion, which seals the wound. That does leave some scarring, but when you treat the lesion correctly, the pain usually goes away. You can do hyperbaric oxygen therapy. We have research for that shows that rather helps. And if you just have a really persistent lesion that is not resolving, they can resect the bladder and cut that lesion out. Bladder augmentation expands the bladder, capacity of the bladder. I guess they would potentially cut out the portion of the lesion, then use a little bit of intestine to create a new pocket that would expand bladder capacity. But I think it's very, very important that you do the easy stuff first. Because ultimately in the end, bowel is not meant to hold urine, and there become issues with the bowel tissue. It gets very mucousy, it can get infected and stuff like that. So we want to learn a lot more about that. And Deb, I'd be happy to talk to you about that. Hey, I need to go to the bathroom, so let's take a quick potty break. Be right back. All righty then. I just want to look at something here real quick. Hold on a sec. I want to see where the big storm is. We got all these flood warnings for overnight. And I've got a little landslide starting right across the street right here. So hold on. I just want to look at the radar here real quick. I want to know where I am in this for when this is gonna. Oh, it's getting close. Oh yeah. Wow. It'll be here probably in 15 minutes. Man, monster storm. It's just west, and there's an arm coming to the south of us that's already, wow. Holy moly. Well, we'll see if we have power. So we have a big flood watch right now, and they're warning of landslides. So oh boy. Oh boy. It's gonna be exciting tonight. Okay. Back to your questions. I'm doing pretty good at talking. I mean, my voice is definitely not as strong as it was, but I think it's going to get better. Angie said, dry needling helps tight muscles. If your normal physical therapy isn't working, yes, I would love to do some more. Isn't it nice? So you can always tell the health of your pelvic floor by how you pee. And so when I went into the bathroom, I almost peed like a horse, and that's like, oh my God, thank you. Because I mean, like literally for 25 years, I was a stopper and starter and a stopper and starter. And you know how sometimes when you pee, your urine goes one direction or another, it's not going straight down. And that's how you know if your muscles are healthy or not. And so that's like, okay, my muscles are good right now. That's great. I'm really happy about that. Peggy said, how long does it take PEA 500 to work on pain? I would say for me, it took a few weeks to really start calming things down. I did just see another study of PEA with shingles, which used a higher dose, and it turned the shingles pain down within a couple of days. But I think it was 900 milligrams a day. Hold on. PEA 500, also known as Peora, palmitoyl ethanolamide. This is, we got a fantastic IC research study with PEA and IC. By month 3, 87% of IC patients reported a significant reduction of their pain and discomfort. And by month 6, many were pain-free. PEA acts by calming nerves down, no side effects, no known drug interactions. Dozens of research studies with all sorts of pain, mostly done in Europe. Used to be very expensive. Now it's very, very affordable at under $30. And so when people ask me what I take, it's like, well, I take PEA because I'm very invested in calming my nerves down. I got the wrong glasses. Oh, wait, hold on. Excuse me while I put on my reading glasses. Because I'm that age now. All right, so hold on a second. So this is 500 milligrams a day. And some patients and some studies use up to 900 or more. So you could, I know that we never want to tell you to go over what a a drug company says. They say 2 a day. I take 2 a day. But I'm just saying some studies test more than that and also show success. You can look that up yourself. You know what? Hold on one sec. We were going to look at, oh, here, hold on a sec, on YouTube. Do over-the-counter H1 and H2 blockers help IC pain? They might help calm some of the inflammation associated with H1 and H2, but it's going to be far more likely that, again, we have to subtype you to figure out what's causing your pain. We have to phenotype you to figure out what's causing your pain, because we have distinct patient groups. So for some people, it's pelvic floor. For others, it's bladder wall. For others, it's the central nervous system. So I can't answer that question unless we phenotype you. And I'm happy to do that. If anybody wants to go into a Zoom, we can close out this meeting by going into a Zoom where you guys can talk to me and I can ask you questions, and we can do that for a little bit. If anybody wants to do that, I'm happy to start up the Zoom and we can do that. Gwen said, what's the best way for pain? It's the best way to ask for pain meds. I've seen 3 doctors and now going to a pain clinic. Don't even want to say the word pain. What about muscle relaxant? I don't want to be a zombie. I have MS too. Gwen, the way you backdoor into that discussion is by talking about your functionality. And so what you say to them is, listen, I can't go to church without pain. It sits to hurt. I can't go shopping. I can't do my washing. I can't fix dinner. I'm in too much pain. What can we do that will improve my functionality? And you let them bring it up. And you, whenever you're working with a pain clinic, you have to be laser focused on cause versus effect. Cause versus effect. You always want to be focused on what could be causing this pain. You want to fix the cause of this pain. You want to use them as a new set of eyes to try to understand why you're in pain in the first place. So you're not going to a pain clinic just for pain care. You're going to a pain clinic because they're master detectives at trying to figure out what's driving that pain in the first place. Because if we can fix that cause, then maybe you won't need any pain care. They just gave you Lyrica. Well, and so I would go back and say, listen, I appreciate the Lyrica, but I want your insight. What do you think is causing this pain? What can we do to fix that cause? I'm not just interested in treating the pain. I want to fix it. Yama says, I have pain in my vagina near my rectum. I feel pain when I feel urine in the bladder. At the time I have to pee. At that time I have to pee immediately. Otherwise, it's very difficult to pee. I have pain in my Bartholin's gland. So, Yama, that pain in your perineum or your anus is probably muscle pain. So the next time you have that pain, just slide your hand down your butt crack to where that pain is. And I'm not telling you to push into your rectum. You're not doing that. You're not touching your rectum. What I want you to do is touch the muscles around the rectum on both sides and see if they're tender to touch. And if they're tender to touch, try massaging them. Try massaging them a little bit. See if that makes it a little bit better. And the Bartholin's gland is a whole nother story, but a lot of that vaginal pain, that vulvar pain and that urethral pain still is coming from tight muscles squeezing nerves. So don't walk away from your muscles. We need to work with those muscles and see if muscles are driving a good portion of your pain. Janet says, what about over-the-counter antihistamines? I have fibromyalgia too, so I'm sure it's part of the neurological, but the blood work does show inflammation. You can always try it, but that's what I call chasing the symptoms. One of the ways we used to describe IC is like having 100 mosquito bites in your bladder. Just like a mosquito injects venom that causes superficial inflammation and pain and itching, urine that penetrates into the bladder wall does exactly the same thing. It causes mast cells to release histamine, which causes pain and inflammation. But that's secondary to what the underlying problem is. So the fact that you have fibromyalgia tells me that you are in the widespread pain subtype, like I am, that central sensitization widespread pain subtype. And so what we know about that subtype is that our target really has to be the central nervous system. That nerves throughout the entire body systemically have become very sensitive because we have a nervous system that's been injured. We call that a central nervous system maladaptation. And it was the Chronic Pain Research Alliance who made that discovery that has been reinforced with research done at the US National Institutes of Health. Patients with widespread pain, when we look at the brain, we see a brain that is stuck in fight or flight. 24 hours a day, 7 days a week, that brain is hardwired to think that your life is at stake. And so what's happening? Your amygdala is controlling your brain, your heart rate is increased, your blood pressure is increased, your muscles are tight for the long term. I started this meeting talking about that. And so you can replay the first hour of this meeting, get a lot more information on that. My voice is kind of at that point where I've got to be a little bit more careful with it now. But therapeutically, patients with widespread pain, we have to focus on breaking that brain out of fight or flight. And injury causes, what the research shows is for 80% of the children who eventually develop widespread pain, including IC and or IBS and or fibromyalgia and or migraines and or vulvodynia, etc. For 80% of the children, there is a history of a major physical trauma that damaged nerves in childhood, being hit by a car, anything at all like that, broken bones, riding a bicycle, falling on your crotch, breaking your tailbone, anything at all like that. 14 days of pain will put that brain into a constant state of fight or flight. And again, we don't think of this as mental illness. We think of this as an injury, a direct injury to the nerves. And that sensitivity is what happens when nerves become injured. And for the other 20% of children who eventually develop widespread pain, it's a history of abuse or bullying. And so I'm in both groups. I broke my tailbone in 7th grade, but I was assaulted when I was in 4th grade. And I did not leave my home without fear from 4th grade through high school, because we had a rapist murderer in my neighborhood who, the year I went away to college, raped and murdered my neighbor. And so my brain got hardwired to be stuck in fight or flight. Now, of course, I knew none of that. So that 4th grade, 7th grade, broke my tailbone. 7th grade, I couldn't sit through class in junior high. They called my parents, took me to the doctor. They thought I had a bladder infection. I took a massive amount of antibiotics. I had urethral dilations. My diagnosis was a urethral stricture. My urethra was very tight. So what they used to do is shove it open with a metal sound called a dilator. I had about 100 of those. Nobody ever asked, gee, why is her urethra tight? Oh, well, now we know 50 years later, because I had tight muscles from my broken tailbone. Okay. In high school, I developed vulvodynia, severe vulvodynia. I felt like I had a yeast infection all the time. I couldn't wear underwear. I would come home from school and I'd soak in the bathtub for an hour. And I'd go to the doctor. Why do I feel like I have a yeast infection all the time? And he'd go, Jill, there's no yeast here. You have the most sensitive skin we've ever seen. Yeah. Why? Because of a nerve injury. I go away to college. Thankfully, things were pretty good during college, although I had a ton of ovarian cysts. And then my first big job after college, IBS cysts. And it was not little IBS. They were bend over and screamer cramps for years. Years. And then migraines hit. And then bladder pain hit for the first time when I was 32, and there you go. And when you're the patient, you're so confused. Gwen says you're telling my story. You're so freaking confused. Why? Why? I want to live life. I want to have babies. I want to get married. I want to have a great job. I couldn't. When I was growing up, I always believed that I would have 5 children, including at least one redheaded daughter who looked like me. I had dreams about that. And I am still stunned that I didn't have children. I had a miscarriage, but I did not have children. Why? God damn it, why? And now I know why. Because I was hurt. All of those pain conditions were the result of an injury that happened when I was very young. It was never my fault. It is not your fault. You have done nothing wrong. I did nothing wrong. We just got hurt. And it was a muscle injury and a nerve injury. Now, for the other 20% of children, it's also a history of growing up with abuse or bullying. The classic example that I see in my office every single week is somebody who grew up with an alcoholic parent, a violent alcoholic parent. And so for those children, school was their safe place. But as soon as they came home from school, the fight or flight kicked in. They became more hypervigilant because they were being hurt. And then when mom or dad got home, whoever the abuser was, they became even more hypervigilant. And then God forbid they'd start drinking. Then that young child's brain is just trying to save that child's life. That brain perceives that their life is at stake because their life is at stake because they have an abuser in their life. And think about what that does to their nervous system over time. They're in fight or flight every night from childhood until they leave that home. Their brain gets habituated into fight or flight. But there's fantastic news. We know how to fix that now. We know how to fix that now. We have to calm the central nervous system. We've got to get the brain out of fight or flight. When we get the brain out of fight or flight and we restore proper functioning of the parasympathetic nervous system, the nerves calm down, the pain resolves. I am pain-free. My bladder pain is gone. My vulva pain is gone. My bowel pain. I have not had bend over and screamers. And I can't even remember when. 20 years? But the most central point you've got to remember, every single person watching this has to remember, is you have done nothing wrong. No shame nor blame. Because I know what you're thinking. You're thinking you're unworthy. You're thinking you're a terrible wife. You're thinking you're a terrible mother. You're thinking all these dark thoughts. Stop it. If you had a child who was hit by a car, or your husband was hit by a car, or your wife was hit by a car, you run to the accident, you sit there, you hold their hand, you get in the ambulance, you go to the hospital, you sit at their hospital bed, and you give them all the care you can. And then when you bring them home, you will make every food that they love. Why do we women assume that our needs are not as important? You deserve that exact same care. Stop beating yourself up. You're a good woman. You just got hurt. And the best part of my job is when I can find a patient who's got multiple pain conditions, they're struggling with anxiety, they're struggling with all of this. And I ask that magic question: do you have sensitive skin? Yeah. You have a wicked sense of smell? Yes. Do you struggle with anxiety? Yeah. We know exactly what that is now, and we can fix it. We can make it better because I want you to have a good life again. I have a good life. I have tremendous regrets. And I ask God all the time, But I think, I think I agreed to this before my lifetime. It's like, this is your lifetime where you get to do this type of work instead of be a mother. Um, I um, I will say, and I don't think she's here, honey. If you're here, one of our members for a long time is actually a very very good psychic, kind of like John Edward. I had no idea. She'd watched me for years, and she called me up one day, and she introduced herself, and she said, um, "Jill, what's up with the cat?" And I'm like, "What do you mean?" She goes, "Every time you stream, there's a cat that walks in front of you, and he plays with your butterfly. What's up with this calico cat? I see it every single time." And I'm like going, uh, "Well, I don't have a cat right now, but my Sammy was a calico cat, and I lost her 5 years ago." And she said, "Well, she's with you every day, every single day." And so anyway, we had a great conversation about lots of different things, and we were talking about, just kind of finding our purpose in life, and was talking about my relationship with my parents and stuff. And she said, "You do realize you were the mother of your dad, in a past life, right? You do get that, right?" And I'm like, "Oh, that makes total sense." So I believe that I will have another lifetime where I will have 5 children, and that's fine. Gwen says, "We are your family now." Thank you. I believe that we're family. You are my sisters and my brothers, and I want you to think of me that way. And if you need a pep talk, if you need some comfort, you're always welcome to call me. And I'm always happy to just try to give you that pep talk. Um, I will say, when I think of my job working with patients, I want to comfort, I want to educate, I want to inform, and then for half of you, I have to kick you in the butt and get you back to doing something, because some of you just do not want to read, or you do not want to try new things, and it's like, come on, girl, it's not you who, it's your body, you've got to do it. So, but I'm very gentle. It's very, very rare that I ever get upset with anybody. I have a very high patience level, tolerance level. The only time, I will tell you, the only time that I have gotten really mad at a patient, now this is in 30 years, was her husband called me and said he didn't know what to do, that his wife was in very, very severe pain, and she wasn't functional at all. She would basically lay in bed all day, and she would take pain meds all day. And so he called for advice, and we explained about IC at the time and diet at the time. And it turned out she was drinking a massive amount of Diet Coke and taking pain meds all day. And she wasn't able to make dinner. She wasn't able to be there for her children. She wasn't able to do anything. That was her life, in bed, taking pain meds and drinking soda. So I gave him as much information as I could, and I offered to speak with her. She wouldn't talk to me, and it's like, "Good luck, hon. Good luck." Well, he called me back a couple months later and just said, "She won't do anything. She won't change her diet. She won't do anything. She won't stop the soda." And I'm like, "Let me talk to her." And he's like, "She won't talk to you." And I went, "Give her the phone." And she stunned me. She said, "Jill, I could care less what you're going to say. All I want is my pain meds. All I want is my Diet Coke. That is all I need in this life." And I chewed her out. I said, "You are condemning your children to live this way without a mother who can show her love? You're not willing to do anything to help you get better so that you can take your children to school?" And I chewed her out big time. She was addicted. She was an addict. And that's what I said. I said, "Honey, you're an addict." You do realize that, right? You are addicted to your pain meds and you are addicted to your soda. And if you want to be a force of good in your family's lives, it's time to battle that. And again, I'm gentle the great majority of the time, but that was the one time I lost my temper. I did apologize, but Rhea said, I was just diagnosed based off symptoms from a urogynecologist. They did the first bladder infusion 2 weeks ago. Oh, and I go every 2 weeks until the fourth visit where she would do a cystoscope. Could the infusions interfere with the current state of what my bladder truly is? No, it'll help if anything. I wouldn't worry about that. Angie says, I know, Angie. Unfortunately, Angie has helped at the IC Network here in the past. It's all up here. Alina says, where can I contact you? Our 800 phone number is right back there. It's on the top of our website, 800-928-7496. You can email me, icnetwork@mac.com. Chi Chi says, I just had my ovaries and appendix removed. My IC is acting up. How long do you think it will last after surgery? So, Chi Chi, here's the challenge. Because you had your ovaries removed, you're now in total menopause. That's going to directly affect your bladder. When I had my hysterectomy and ovaries removed, I was shocked I felt like I aged 10 years in that first year from the loss of estrogen. And so your bladder wall reacts to that. Your bladder wall needs estrogen to produce mucus. And mucus is what protects your bladder. We have a nice thick coating of mucus in our bladder, which acts as a barrier. Unfortunately, that mucus is estrogen dependent. So when you're young and have lots of estrogen, you got lots of mucus and your bladder can protect itself. But if you're on birth control, if you're on Lupron for endometriosis, if you've had your ovaries removed, or if you're just older like I am, you don't have the estrogen anymore, which means you don't have the mucus anymore, which means your bladder's ability to defend itself is now compromised. And so using topical estrogen to help that skin plump up and produce mucus is one option. You could also, I mean, you're never going to have a teenage bladder anymore, even with topical estrogen. Doing something that can give your bladder a coating effect might be helpful, like Bladder Builder or Bladder Rest or Cystomend or Cystoprotect. Those are all on the IC Network website in our shop. Look for a chondroitin-based supplement. But the other thing you really have to think about is because you had pelvic surgery, your muscles are probably quite tight. When I had my hysterectomy, wow, my pelvic floor muscles locked down and spasmed. And that spasming lasted months. And to get out of that spasming, I did physical therapy. So I'm looking at trauma that's caused your muscles to get tight combined with some estrogen atrophy at your bladder wall. So that would be my guess. I don't know when you had your surgery. You're probably not going to do physical therapy for at least 3 to 6 months. But the bladder wall issue, topical estrogen, you can potentially do. You could talk to your doctor about that. I would lock down on your diet right now because, again, your bladder can't defend itself. This is not the time to be doing a lot of coffee and soda. Susan said, my bladder stimulator needs to be replaced with an MEI compatible one, but Dr. Evans says me having to have an appointment for the rest of the year. What? Are you kidding? Normally, to get into one of the top IC doctors, it'd be like 2 to 3 months. They don't have an appointment for the rest of the year? Wow. Susan, what I think I would do is I would call the manufacturer of the company and the company of your current stimulator and ask them for help. Tell them what's going on. Tell them that your device is not functional, and see if they can open a door for you in his clinic, maybe, or maybe even in another clinic nearby. Gwen says, addicts don't like to hear the truth. Only God can help at that point. You're right. You're right, honey. Alina says, how often should I have pelvic floor therapy through Kaiser? I was told every 2 to 3 weeks. I'm getting evaluated at physical therapy, but City of Hope through my other insurance. Everywhere else, physical therapy access is poor unless it's a private office with no insurance taken. The two insurances, I really do not want to pay out of pocket for more therapy. Kaiser is tricky because they don't have a lot of physical therapists. I'm a Kaiser patient, so I was lucky to get in once every 3 to 4 weeks. And sometimes that's just not enough. And so I eventually paid to go outside of Kaiser also. Debbie said, I'm going to physical therapy tomorrow, having a hard time figuring out what's flaring me. Medicine, Bentyl, and amoxicillin, doing bladder installations. They are hurting. I have very bad pelvic floor pain and spasm. I'm under major stress all the time. Definitely going to look into therapy for my anxiety. Thanks, Jill, for always being there. You're welcome, honey. You're welcome. Angie said, I've been on 1,000 milligrams of amoxicillin a day since Friday, and I'm having terrible bladder pain since starting it. Amoxicillin, that class of antibiotics can be a bit more irritating, especially Augmentin. You can call the doctor, say it's killing your bladder, and ask them for something else. If they did the proper drug resistance testing, they should have a list of antibiotics that they can recommend. Maybe there's another antibiotic that won't be quite as traumatic. Susan said, I'm in so much pain right now. I'm in the fetal position. Oh, honey, big giant hug to you right now. I'm so sorry. Gay says, you're like a long lost sister. I try to be. I want to be. I want to be your long lost sister. Let me tell you. Susan said, how does a doctor really know what's IC of the bladder when there's no test for it? Because we phenotype now, Susan. We phenotype. Come to our website, icnetwork.org, go into the IC pull down menu and read about phenotyping. We're not all the same, and most of us have a normal bladder, and it's not our bladder, it's our muscles and nerves. You need to be properly phenotyped. I can do that in about 5 minutes. So we can go into Zoom. If anybody wants to go into Zoom and talk to me, we can do that. And I can phenotype you there if you want. Gina says, I want to thank you so much for talking this week. I ordered my PEA. I'm ready to talk to my doctor this week. Yeah, you're ready to rock. Good. Susan, I believe you, honey. Denise says, I had my ovaries removed to benign cysts on compounded. You're on compounded estrogen recommended by you, and I feel like a new woman. Yeah, baby. Regularly prescribed estrogen totally irritated me. Thank you. I'm so glad the compounding worked. Susan said, it needs to be replaced so bad I can't even have an MRI done. Call the company. I mean, like literally call the company, call their patient assistance line, explain your story. You can get your case escalated that way. Those companies all have reps that work directly with the doctors. You might be able to get yourself in much earlier if you kind of suggest that there's a issue with the device. And there is an issue with the device at this point in time. John said, why do antibiotics reduce prostate pain even if there's an absence of infection? John, because of the anti-inflammatory effects. Antibiotics also have an anti-inflammatory effect. So it's a fake out. You feel better, but it can be because of the anti-inflammatory effect. But we're also learning a lot more about chronic UTI also. Susan, I wish I could hug you through the camera. Maria, I love your name. Oh, that's so beautiful. Thank you for your support. You're very, very welcome. Susan, I'm desperate for anything at this point. Okay, tell you what, let me open up the Zoom meeting and let's transition this into a Zoom. And then we can you guys can talk one-on-one. And so hold on a sec. There's my Zoom, and let me start a meeting. All right. It is now started, and we'll start the video. There we go. And oops. So here on Facebook, I'm going to send you a link. I will post this in here. So it's not going to be a long Zoom. My throat, you know, guys, a good 30 minutes, 45 minutes, whatever. But let's be gentle to Jill's throat. Okay, so for you guys on YouTube, let me get you the same invitation. So hold on a sec. Let me just, I have to email it to my other computer. So for anybody who wants to come into Zoom and talk and have questions, happy to do that. All right, hold on one sec. And for anybody who wants to play Fortnite later tonight, email me, icnetwork@mac.com. Okay, hold on, YouTube. Okay, so on YouTube, I'm going to give you guys the Zoom invite too, okay? The crafter artistry says you mentioned SI pain before. I'm struggling with a lot of SI pain, hip, groin, coccyx pain. Glad you're getting over the flu. Yeah, honey, it messes up your pelvic floor like a beast. I hope you have an SI belt. It really helps. All right, so those of you on YouTube, there's your link. Feel free to come into Zoom if you want to stick around and ask questions. You guys on Facebook, you also have the Zoom link. If you find these meetings helpful, please come on over to the IC Network. Please make sure you sign up for our free newsletter. But even better, become a member and get our magazine, the IC Optimist, because honestly, that's where I do my best work. It's in our magazine. I'm working on the winter one right now. I have a group of writers who work with me, and our magazine, the IC Optimist, is the bomb. It's really, really good. And that's how you can support these meetings so that they can continue, because that's what helps us pay the bills. So you can get a membership for $25 a year, but there's more too. Oh, look at all you people joining. Holy moly. Hold on a sec. Wait. Okay, there's one. Paola, there you go. Sharon, there you go. Michelle, there you go. Marianne, there you go. Alina, there you go. John, there you go. Okay, so again, what we're going to do now is we're going to transition this meeting over to Zoom. You've got the invite. Come on over. Otherwise, I'm going to go ahead and say goodbye to YouTube, and I'm going to say goodbye to Facebook. All right? Carry hope in your heart. You're not alone. Be strong. You've got this. If you have questions, feel free to reach out. Okay, I'll talk to you later. So YouTube is getting shut down now. Bye, YouTube. Okay.